Well, good morning everybody and welcome to today's session of the Children and Adults Health and Wellbeing Policy Development and Scrutiny panel. I will introduce myself and go around the panel so they can each introduce themselves to you. If there are, if you are not on the panel and when it's your turn to speak, if you can make sure you introduce yourself so we all know who you are as well. If you're a member of the panel, can I ask that you also swipe in as appropriate so that the camera knows who you are. Right, so my name is Dina Romero and I'm a councillor in Southdown and I chair this panel. David, would you like to introduce yourself?
David Harding, Ward Councillor for the Chew Valley.
Michael Orton, I'm the Ward Councillor for Mittenhall North.
Councillor Joanna Wright, Lambridge Ward.
Councillor Paul Crossley, Southdown.
Councillor Barrett Pancania, Coombe Ward.
Councillor Eleanor Jackson, substituting for Councillor Leslie Mansell. We have adjacent wards, Westfield and Radstock.
Good morning, everyone. My name is Mark Downford. I'm the Democratic Services Officer for the panel. Thank you.
Good morning, everyone. I'm Kerry Williams, and I provide the Scrutiny Officer support to the panel. Thank you.
Good morning. Good morning, Christopher Batten, representing our National Education Union, non-voting member. Thank you.
Have I missed anybody on the panel? I don't believe so. Okay. Mark, could you tell us what to do in an emergency?
Yes, of course, Chair, no problem. If the continuous alarm does sound, we must evacuate the building and proceed to the assembly point. From this room, we follow the green running person signs to the exit, using either the marble staircase or the main staircase. Please do not use the lifts. The assembly point for this building is the Orange Grove grassed area, just outside Brown's Restaurant. And there's an evacuation chair for use by disabled people who so wish in the corridor outside the Council Chamber Public Gallery. Alternatively, the area at the top of the marble staircase has been designated as safe refuge where persons needing assistance should assemble. Thank you.
Thank you. And we have apologies, I think, from Leslie Mansell, Omkar Saini, Liz Hardman and Kevin Burnett. Are there any other apologies that I should be aware of? Okay. And as Eleanor points out, she is substituting for Councillor Leslie Mansell. We now move on to declarations of interest. Are there any declarations to be declared? Thank you. There's no urgent business. And now we move on to public and councillor statements. I'm going to invite Councillor Ruth Malloy to speak first.
Sorry, is it working? Yes. So, yeah, good morning, everybody. I recently joined the SACRE, the Standing Advisory Committee on Religious Education, and that's why I'm here. But because the annual report has come out, and as part of the Cabinet members' report, you've seen it already, we're here to support that. However, I was not expecting to be the one to present it, as I only recently joined SACRE, and no, you're not.
No, you're not presenting it.
No.
I understood
I'm just
you
saying
wanted to
that's
make
why
a
I'm
statement.
here. Yeah.
I understood you wanted to make a statement. Is that not correct?
Well, yeah, basically, just to say that I joined initially in the summer, and more recently that was confirmed as an official member to represent the council, but because the report covers the period from September 24 to August 25, I don't feel that I'm able to say too much about it, but so basically that's I'm here to support Councillor Jackson because I'm just, joining her as the second councillor representative, and I understand that Olwyn will present. Is that right? Anyway, thank you.
Thank you very much, Ruth. I don't think Olwen was going to present a report because I think it's wrapped up in Paul's statement, but and I'm sure Secretary will be pleased with your support, especially with attending this panel as well. Right, we move on now to Becky. Becky Somerset from the Third Sector, from 3SG, and I understand you want to make a statement.
Good morning to members of the Scrutiny panel, and thank you to the Chair for allowing me to speak on behalf of the Third Sector in Baines. I am today representing 3SG's membership network of 260 charities. I wanted to make members aware of the most recent Council Budget 26-27, which has referred to £250,000 worth of savings to be made from contract management delivering greater value. It is expected that a list of the Council's largest contracts will be drawn up to see how these savings could be made. We hope that this list would primarily focus on multi-million-pound contracts via waste and highways, but I must flag that there are larger contracts that go to the Third Sector the further down the list you go. Whilst I have been separately assured by both the new Chief Executive of the Council and the Director of Resources that charity contracts will not be touched, I want to keep the risk associated with cuts of any kind at the forefront of members' minds. Those of you will remember seeing me here before when the sector faced a 1.3 million cut, which we are still navigating, and many of our contracts have historically been run with zero uplift, with services running at a loss to the charities delivering them. This is completely unsustainable. The NHS 10-year plan and the ICB's focus on preventative care in communities mean that investment needs to be made in these services. Cost-cutting exercises, no matter how small, could mean closure for some services that are really struggling to deliver with dwindling resources, and eventual increased cost to the Council in order to meet your statutory responsibilities. For too long, the Third Sector has been expected to find a way. Our options are dwindling. There is less funding available and competition is greater than ever before. This downward spiral cannot and must not continue because our residents will suffer if services close. I have asked to be kept informed as this list develops because I fear that if larger contract renegotiations fail, the Third Sector will be an easy target. I would call for more open, transparent budget setting in future, with the sector consulted on any changes that might affect them. Far too often we find out too late and are expected to deal with the consequences. The Equality Impact Assessment for this year's budget asserts there will be no material effect on any groups covered by the Equality Act, but if these cuts do impact the sector, I would question this assessment and the process behind it. Contracts that could be affected are services for our most vulnerable residents, including domestic abuse survivors, children with autism, early years, teenagers who need support, and advice services to residents in significant debt. Also services that help support older people to live in their own homes. Many individuals rely on several of these services. In Wiltshire, a framework has been developed following an LGA peer review which sets out clear expectations around how the Council and Third Sector should be working together. I hope this can be created in Baines too. Our ask is that Scrutiny panel members continue to champion the sector in all conversations that you might have. We need investment and good working relationships, not the gradual erosion of contracts and services that leaves organisations with uncertain futures.
Thank you very much, Becky. Do we have any questions? Barrett and then Joanna.
Thank you, Chair. Becky, thank you. If I have understood what you just said correctly, you said that you would welcome closer working with the budget people whilst the budget is being reconfigured, rather than to find out that the budget has now been altered or has been reduced or whatever. If that is the case, my question, Chair, is why are we not working in close relationship between the providers and the purchasers, so to speak, the budget setters? I think it is a bit hard to find out that the budget has been altered, but we never sort of sat down and talked with the people who provide the services. Am I making sense?
Thank you for the question. Yes, I think there were definitely nods around that, and I think Becky was referring to previous experience, which obviously we want to make sure does not happen again. So I'll take Joanna, and then I think, oh gosh, I don't know which hand went up first, but I'll take you in turn. Joanna.
I just noticed Darryl Freeman might want to answer that question.
Well, you indicated you did want to speak.
I'm happy to join in the conversation, but councillors, feel free to go first, and I'll just chip in.
Thank you for your statement. You've talked about two other organisations, the NHS/ICB and also the peer review in Wiltshire. I guess I'd like to pull out a bit more how we in this room, through Scrutiny, could better hold the ICB and NHS accountable for how they work better with you, and also this peer review, how can we make sure that that is implemented in Baines, and how do we get hold of that information to ask for that at this committee?
Some of that I think will not be your answer, for you to answer. Sorry, Becky. Becky, and then Lucy, and then Darryl.
Thank you. Just to say that in terms of ICB, we have a VCSE alliance across Baines, Swindon and Wiltshire, so progress has been made in the 4 years I've been in post in terms of better working relationships with the ICB, so I feel like that is ongoing but needs significant attention, particularly with all of the changes going forward, and I'm thrilled that Lucy is our new place director and we'll be working closely with her going forward. In terms of the budget, I think there are consultations, but I think often we find out slightly too late, and I would really welcome being involved in that process from the start. Similarly, we've been talking about, as a result of the 1.3 million cuts, around the sector being involved in terms of recommissioning contracts, co-production, co-design of specifications and tenders. So it's just that better, greater working relationship with the council and the third sector. I think the new chief exec is keen to make that happen, and I will be showing her that new framework and seeing if we can recreate that here in Baines. I'd really like to see that happen.
Lucy?
Thank you, Chair. So, as Becky alluded to, the ICB is really committed to working with our VCSFE partners. As part of the ICB model blueprint, our ambition is that more decision-making will be made locally at place, and we absolutely are committed to having those collaborative conversations, and we will be working with VCSFE partners to build what that looks like moving forward.
Thank you, Darryl.
Thank you, Chair. So just to endorse Becky's comments really about the strength of the relationship between the exec leadership team and Becky and other partners, and a real desire to want to work differently going forward, particularly around prevention and early intervention. A point of clarification to a comment that was made earlier on, the budgets for the individual agencies hasn't changed or hasn't been reduced. I think was the point you had made, Councillor. The saving is being identified through the management of contracts, which is a slightly different process. I'm very mindful, Chair, that you had asked us in the past for information about where any specific children's and or adults contracts, and the directors of children's and adults are working with the resources teams at the minute, so we will need still to come back to you on that one. But we've made very strong representations around which contracts we've already identified savings through, so there won't be any double counting in that process. Yeah, absolutely endorse the comments that are made about the relationship and the need to work collaboratively going forward.
Okay. That feels more reassuring, but let's, Becky, if you don't mind, I'll ask Eleanor to speak, and then Michael, and then come back to Joanna. Eleanor, you are next. In fact, you are now.
I can't see you waving your pen, you see. Sorry about that. Yes, I mean, I do wish, in some ways, I do wish Becky would come back to being editor of the Midsummer Norton and Radstock Journal, where she was legendary for the accuracy of the paper in those days and the way it was presented. But this is a really important statement from her. Am I right in thinking, from my reading of the paper, the council papers, that the services which we expect the 3SG section to cover are what you might call non-statutory, that we don't have to provide a youth service, we don't have to at the moment anyway, under the current legislation, have specific services, say, for autistic children. Is that correct? And then, of course, well, we just have the reassurance about the cuts, but that is not how I read the papers. I thought there was a £10,000 cut coming down the track.
Thank you for your question, Eleanor. I don't know, Darryl, did you want to pick up on some of that?
So the saving, the £250,000 overall, is coming from the contract management of a number of very large contracts, and it'll be for the Director of Resources to say which ones they are at the minute, 'cause that's not within my purview. We're just contributing to the conversation, so I can't necessarily add more clarity to that particular point of which contracts. To the general point around what is statutory and what is not, again, the existing contracts aren't affected. Existing contracts are honoured, and we're already starting to have conversations about future contracts. It is a reality for local government and for councils that every time you go through a budget cycle and a budget process, that there are some tough questions that have to be considered. One is, what do we have to provide? What do we currently provide that we perhaps don't have to, and can we afford it? And that will be that's been with us for years, and that will continue to be with us for years to come in that basis. You know, this council and this leadership team are absolutely committed to shifting resources into early intervention and prevention wherever possible. That's the right thing to do. That resonates with the NHS England ICB neighbourhood plan and integrated neighbourhood teams. It resonates with government policy at the moment around Families First partnership. So there is a shared commitment across a broad partnership to shifting scarce resources where we can into earlier intervention and prevention, and I hope that doesn't change anytime soon.
Darryl, I know, Kate, you wanted to just quickly say something.
Thank you, Dina. I guess I just wanted to echo Darryl's point and welcome his view that your ambition and commitment in the Council is to work closely with us and support that relationship. I think it's just, perhaps I'll pick up on Councillor Ella Jackson's point about the statutory requirement, and I think it's just a really important point we need to hold on to, which is that the role of the third sector hopefully should be preventing you as a statutory provider having increased services coming down the line and sitting in that Care Act requirement, because we've done the work that we've done in the early help stage to prevent that from happening. And I think we shouldn't lose sight of that. That is the whole point about early intervention and prevention, and the work that we can do to avoid the kind of downstream piece costing you a lot more money and time.
Thank you very much, Kate. I think that was a very well-made point. Michael?
I guess mine's a statement rather than a question, but obviously as someone who has worked in the third sector all my professional life and being a member of this particular panel, I'm very keen to support all the work that 3SG are doing, and if I can be a kind of liaison and a kind of go-to for information, then I'm very happy to be that role and to meet you guys separately and have a chat about how best I can support you.
Thank you. Have we asked all the questions we wanted to ask? Sorry, Joanna, and then finally Paul May.
I'm still a bit confused, because when we get the budget papers, we don't get very much detail about anything. And I just feel that, I've sat in this room now for years, and each year we seem to have the same space of there are budget cuts, but we don't know what we're cutting, and we're going to go and talk to each other, but we're not really talking to each other. We need better communication. And we go round and round in this cycle every year. I would look at officers and say, you're not telling this scrutiny panel very much about what you're doing, how you're doing it, and what the detail is. And we are left every year to just go, we don't know enough. Now, I'm not sure how much you can tell us or can't tell us, but we don't know very much. And we are still in the position where 3SG and representatives who work really hard in our community are feeling let down. And we need something better. And there clearly seems to be other models in Wiltshire to take things forward. So it's just a call, really, that we have some paper and a forward plan, because we keep asking for that, that something moves from this, rather than the same circle that we go round and round in.
I think everybody's agreeing with you, Joanna. Actually, that point about the peer review, is it possible that we can mirror, is it appropriate to mirror any of the work that has been suggested in Wiltshire here? And if not, are we seeking our own peer review?
Which peer review are we talking about, sorry?
Peer review on how the council works with their equivalent of 3SG.
I don't know. We haven't kind of got to that stage of thinking about a peer review at the minute. I think we're very much in the relationship building and scoping stage, and I think that's healthy. Looking to my colleagues, they're nodding. So I think then there's something about how we build on that as we're going forward. We're kind of building a coalition of the willing at the moment to think about our future strategy around prevention and early intervention. Yeah.
Thank you. Paul May.
Thank you, Chair. I'm Paul May, I'm the Cabinet Member for Children's Services. I just wanted to recognise, and I'm also the Chair of the Health and Wellbeing Board, where the voluntary sector 3SG, with both the Chief Exec and their Chair, my colleagues on my left here, members of that Health and Wellbeing Board, and very, very active in terms of working with the community. Both Alison Bourne, who's the Cabinet Member for Adult Services, and myself have been very, very supportive of working with effectively with the voluntary sector, because quite simply they can provide things in different ways than local authority can, and under those circumstances they bring a lot of added value to the work that we all do. And the important thing really is to recognise that we're sat here today talking about issues and strategies and the implications, but important for both Alison Bourne and myself is the effect we're having with the communities that we serve. And I think under those circumstances, when we're talking about the budget, we go through a formal process quite clearly with the scrutiny committees asking questions and getting answers, and then that goes through all the way through to the council decision on the amount of money that we're going to be raising. We have a legal duty to make sure that we have a balanced budget every year, and under those circumstances this year we've agreed that the council tax will be 4.99%, which is the limit that the government set. And in terms of the pressures that have been there with children's services, I'm very, very proud that this council is actually supporting children's services, but not like some of the other councils having to go and ask for additional council tax money. So I think that's the issue that I would say we value, and it's really good that the new Chief Executive is very positively talking about working effectively with the voluntary sector, and you'll get the full support from Councillor Bourne and myself in those discussions moving forward. Thank you, Chair.
Thank you, and I think we're all very grateful to Becky and to Kate for reminding us of the fantastic work that you do and the contribution you make into ensure that we can deliver those statutory services. Thank you. Right, the next public speaker is Mark Baldwin.
Yeah, my name is Mark Baldwin, and professionally I'm a social worker, and the last job I had before I retired was as a lecturer at the University of Bath. I'm talking about the Connecting Families team, which is part of Children's Services, and I ought to declare an interest that my partner actually works for that team. But since I retired, I've actually, for the last 10 years, I've been working as a volunteer for the Connecting Families team. So I'm a long-standing volunteer for that team. And I was really shocked and dismayed to discover that the service is being deleted in the wake of a national change to children's services. The government policy doesn't require this action to be taken, the deletion of the team, but the authority has chosen to destroy what is an award-winning service that's been phenomenally successful in turning around the lives of children and families in local communities. So as a volunteer, I've seen the response of parents and children to the friendly, imaginative and professional approach of the workers in this team. Families who have been severely disadvantaged by mental ill health, unemployment and poverty have had their lives transformed by the family-centred and collaborative approach of the team. And I ought to say, given the last discussion, that collaboration is not just with the people who use the service, but also with a wide range of third sector organisations as well. This is what I've observed, but I also know from the feedback that the team always seeks from people who use the service. That's what they almost invariably tell the team. I am therefore sure that there are many families in the community who will share my dismay at the team's demise. So we've also heard talk this morning about prevention and early intervention. Early help is precisely what the Connecting Families team provides, but it seems like to me, as from my perspective, that managers in children's services want to say goodbye to providing a service that will prevent some families getting into worse difficulties, to concentrate far more on intervening when families fall apart. To me, professionally and as a volunteer, that seems a stupid and wasteful approach. We all know that prevention and early help actually works. So I find it hard to believe that the collective talents of this team, and I've already said collectively is how they practice, both with service users and voluntary organisations, they're being ignored by the most senior management. So, for instance, I know that the team have not been visited by the group of managers who've been tasked with making these changes, with team members either being made redundant or pushed into jobs where their skills will be sidelined. The demonstration outside suggests that actually this is wider than just the Connecting Families team, and it's affecting other Bath and North East Somerset staff. But my particular concern is why the talent, commitment and effective professional practice of the Connecting Families team is being wasted by the Children's Services Directorate. I also understand that these changes were made without elected representatives being informed. That's what I've been told. So deleting a successful service which is much valued by local people without discussing the implications with councillors who were elected by those people to represent their interests seems strange and somewhat devious to me. So my hope is that the council will be able to change its mind about these things and reinstate the Connecting Families team.
Thank you, Mike. If you could turn your microphone off. So I know that Councillor Paul May will be making a statement that may well address some of what you have spoken about. But are you okay if members of the panel ask you some questions now?
And obviously I will answer as a volunteer for the Connecting Families team. My knowledge more widely is not so great.
Thank you. So does anybody have any questions they'd like to ask of Mark? Joanna.
Thank you for your statement. It's very alarming to hear that this clearly dedicated team that's working very hard in our local community is being eliminated. As a volunteer, I'm not asking for names of people, but when you come into contact with families, can you explain a little bit more about what that work is and what that looks like for a particular family?
The work that I have done has, well, I've been Father Christmas at the Christmas party, but that's not a particularly professional approach. But most of the work that I have done has been in events which the team have put on to provide support and activities for children and their parents or their adults, carers. One of the things that I have an interest and expertise in is craft work based around nature. And so we've done a lot of work in relation to that. It's about engaging young people in particular, and indeed their parents, in that work, getting them out into nature and actually creating things which the children can take home and value. Obviously, doing that work, you get to know the children fairly well. It comes across very loud and clear that those families and the children feel extremely well supported by the team. This is a more fun thing to be doing, but I am very aware that there are other things that are going on as well. On one occasion, I was asked to go and help clear one particular family whose garden had become completely overwhelmed with junk, I think would be the best word. And we spent, the team, several members of the team and volunteers spent a whole day clearing their garden. One of the things I understand from my professional background is it's very easy for families to gradually become overwhelmed with their inability to deal with things for a variety of reasons. And clearly that's what had happened to this family, that they had become overwhelmed with the junk in their garden. They were hugely hugely grateful for the help that we were able to give them, for instance.
Well, from what you're saying, what I'm essentially hearing is that the input that the volunteers and this team makes has huge impacts on lives, because you're basically taking them into positive spaces, and from that probably other services, police, courts, etc., are better they're not going into those spaces, so all of us are benefiting from this work.
I would say absolutely that's the case. These are families who, as I'm sure people are aware, the thresholds for going into families being referred to social care are extremely high. So these are families who are in substantial difficulties, but almost invariably they're being prevented from going on and being referred to children's services.
Thank you, Mark. I have another question from Eleanor Jackson.
Thank you, Chair. The difficulty when you're a ward councillor is that a resident presents, it's usually herself, with a problem, and you don't know if it's a major problem, something that crops up in the system, a communications problem, or what or not. But I do have a resident who's become homeless as a result of domestic violence, and it's the Connecting Families, the South Side, the system that she latched into that really saved her, I would say, without exaggeration. So I'm just wondering, is this typical, or was that just a Westfield aberration, that you're able to help particularly where the mother is cracking up, to use a rather colloquial phrase?
Like I said, I don't have a wide knowledge of all the work that the team do, but I would think that would be absolutely typical from what I have seen as a volunteer of exactly the kind of person whose life the Connecting Families team can turn around. And it's interesting that you should say in collaboration with Southside as well. That's precisely the kind of way I have seen the team working, because the parents will talk about the other organisations apart from the Connecting Families team that they're engaged with and receiving help from.
Thank you, Mark. Are there any more questions for Mark? And the next item, actually, we'll be coming back to the sort of this topic, and obviously you're more than welcome to stay, and I hope you will stay for that. Right, so the next item, as I said, is the Cabinet Member update. In case anybody's worried about the minutes, I'll put them to the end of the meeting. Councillor May.
Thank you, Chair. I just want to start off by recognising the value that the Connecting Families has always had for part of the North East Somerset Council. So I understand absolutely their concern about this review that's currently taking place. But be very clear, this is a consultation phase, and at the appropriate stage, decisions will have to be made, and those decisions will be carried out in proper consultation, and we will bring back to this committee either at the next children's meeting or at a special meeting at some stage in the future where we can go through all the details. But the value of the Connecting Families team is part of the change that the government's asking us to actually implement in terms of families first. So we want to use the skills that have been developed in that team in the future for increasing our early intervention for families and moving forward. And under those circumstances, it's not about doing away with the team, it's about using that team in the most effective way in the future for the services that we need to be providing. So I think it's not that everybody's going to be made redundant. There are some posts at risk in any review that you carry out, but as a council we always try to make sure that we deal with people in the best way possible. And it's unfortunate that we're in this situation today, but we will continue to work with our staff in the most effective way as we can. So that's what I would just like to say on that, Chair, at this stage. And I don't want that team or anybody to think that we don't value that team for what they've been doing in the past, and we want to use it more effectively in the future. So shall I go on to my report then, Chair?
I think actually we might spend a little bit of time on this part and then we can talk about the rest of the report, I think, if that's acceptable to you. I just wanted to pick up on one thing you said, which was a meeting at some point. Can I ask that we have that briefing sooner rather than later so that actually we can all be brought up to speed and you know, give our thoughts in that process as it's happening?
I very much welcome that, Chair, because I think it's making sure that elected members are involved in that discussion. It's an officer process at the moment, but it has got to be accountable through the normal democracy, through myself and through this committee for scrutiny. So I think that would be really worthwhile for us to make sure that we actually do pick that up and deal with that effectively in this proper process. Because of some of the issues around the start of that process, which I think we've acknowledged didn't go the way that we should have done, that we've extended the consultation period to allow some extra time. So I'm more than happy to ask the officers to come back and give a full presentation to this committee as a dedicated meeting, or if we want through our normal meeting, but I think that's probably too far away because that's 2 months away.
Absolutely. No, I think I'm speaking for the whole panel here that we would appreciate a dedicated meeting well before the next panel meeting. Thank you. Okay, are there questions you would like to ask of Paul on this item as opposed to the whole of his report? And we'll come back to the rest of the report in a moment. Councillor Paul Crosley.
Thank you very much, Chair, and I hope really insist that Councillor May does come back to this PDS panel with analysis of the consultation before Cabinet or Paul May makes a decision. But the question is, what is the change that the government is asking for that has led to this?
Families First is, and it is in my report, Chair, but it's basically, it's moving the role of local authority social care to having a much more integrated front door approach, where you're actually working to reduce the number of children that have to come into the system by working with families in a sensible and appropriate way. So it's shifting towards early intervention, which Councillor Jackson had previously made the point that those services used to be and became far more discretionary, and it's now making it much more compulsory to actually thinking about the front line. And under those circumstances, that means that we need to think about how we work more effectively with our partners in the community, and that we can actually do that in a sensible way moving forward. Can I bring Jean in at this stage, Chair, because she can give a bit more detail in giving that answer.
I'm Jean Kelly, Director of Children's Services and Education. We presented previously to the committee about the changes that are required legally. So the Family First reforms are a mandatory programme for all local authorities, will form part of the Children's Wellbeing and Schools legislation when that receives royal assent. And the key elements that we were asked to develop ahead of royal assent is developing multidisciplinary family help teams. So for most local authorities that has required a shift. So integrating colleagues that will work from a continuum of early help through targeted early help into child in need and child protection. So it requires bringing together all of the colleagues that undertake that work into dedicated teams where families will experience the least changes of professionals possible. And so what we are doing, what we are proposing, is to bring our Connected Families colleagues who do all the things that have been described earlier in a fantastic way, bringing those into those teams so that we can make sure all of our practice reflects that, as opposed to sitting in one team. So that's the family help element. So it's really making sure there's a strong continuum there. The second element is family group decision making. So we have a family group conference service in Baines, but what we have been asked to do by the government is to develop a much broader approach to family group decision making. So it can be a family group conference, but it's making decisions with families at the point of need, whereby we prevent, as with the family help teams, as many children as possible escalating into heavier statutory interventions so that we support families to stay together and to be supported in their communities. The third formal element of the changes is a slightly different one. So this was born of some high-profile child deaths nationally that were reported on in a national report by the National Panel for Safeguarding in 2022. And the high-profile child deaths led to a very clear recommendation as part of Family First reforms to develop what are called multi-agency child protection teams, where you have, and you may have one or you may have more, depending on the size of your authority, where you have colleagues who are responsible for overseeing decision-making around child protection investigations and child protection planning. So you've got two strands: earlier help, intervention and prevention, and with the multi-agency child protection teams, a much more robust approach nationally to safeguarding. And one of the things that we decided we had to do in Baines was to develop our referral mechanism. So Paul has described the integrated front door, and that is very much what we're doing. We feel that we must have a much more robust approach to be able to receive referrals right from an early help, right through to those statutory concerns where children perhaps are being harmed, so that we can field all of those and direct those to the right teams and the right services. So that is it in summary.
Thank you, Jean. Sorry, I'm going to just use Chair's prerogative. Do you think you've explained to staff this process as clearly as you've explained it now?
So there's been the paperwork and the guidance, the national direction of travel has been available for a significant period of time. We have held workshops with colleagues. There has been a range of engagement activities before formal consultation began In terms of those required changes nationally, it's very available, and we've made it available. And we also had a range of work streams in relation to those core changes and engaged our staff in those work streams and those work groups in order to think about what that might look like locally.
And you think that, and I think there was a commitment that there was going to be more work in the next, the next few weeks. Is that correct?
Certainly, Dean and I were having this conversation earlier on. Absolutely. I think there's as in any formal consultation, the language of consultation isn't always the easiest to access. And I think, certainly I was listening to some of our colleagues that were outside the front doors early on this morning. There are some legitimate questions to be asked around the clarity of the messaging that came out last week. And I think both Jean and I are absolutely committed to doing our best to answer those questions transparently, honestly and quickly through frequently asked questions and any other means that we can do.
Thank you, Darryl. Joanna.
I think we're going to have to close the windows. I don't want to do that on that group of people, but otherwise it's very hard to hear. I couldn't hear Darryl Freeman at all.
Can we ask somebody to organise the closing of the window, please? Joanna, do you want to ask a question in this pause?
Thank you to Paul May and to Jean Kelly. I appreciate very much, this is so far an operational matter that has been directed through, sorry, it is challenging to speak. Okay, this will be has been directed by changes at the governmental level, and now you're looking now at royal assent. However, I'm just going to go back to you to the minutes from the 19th of January of 2026, which we have yet to formally approve, and I will just read from it because I asked this question then in January. Councillor Wright said that she did not think that the councillors had been informed about the ACAS discussions and asked how the possible drop in morale would impact their work. The Executive Director, People, said that it was his view that these officers still remain motivated, committed and passionate about their work, and that it was a small number who were unhappy with certain terms and conditions. The Director of Children's Services and Education replied that the majority of staff benefited through the Being Our Best process, but she was aware that some colleagues were unhappy and that they were working to find solutions to the issues raised. The Chair asked the panel to be informed of the outcome of the ballot on its conclusions. Now, I'm delighted that you have now informed us as councillors, but I can see people in the gallery, I can hear people outside. I came through the gates this morning, and there were an awful lot of people at 8:30 in the morning who were very, very unhappy. So, first of all, I think it is disingenuous, first of all, in terms of the budget setting, in terms of children's services, being told that there was a lot more money and that was going towards it, when what we're hearing from people today is quite a different matter. In speaking to somebody this morning about why they were standing out there and why they were angry, they said to me that they have worked in children's services for years, that they work in the fostering department, and one of the key things was their responsibility to be trauma-informed and relational practice, which was central to this council's way of dealing with stuff. And in terms of kinship care, that we needed to work very hard in care, which was labour-intensive, and there was a huge level of expertise. And the way that you are approaching this was that you are essentially creating a system that is already overstretched by reducing managers at a certain level and taking them out. And she was saying that they are already overstretched and are not even getting the attention and the support of the managers that they presently are needing to get support from. And this not only impacts the children's lives that they are working with, but it impacts the responsibility of Baines as a council and how it does due diligence in terms of what you have said previously about overseeing child protection. So I hear that there have been deaths in child protection in the wider community across the UK, and that we have to work better. But what I've heard from people within the service is that they feel that the way that you guys have approached this is one that will make that service even more challenging and unskilled. That a lot of people are not working to contracts, they are working on short-term contracts, they don't feel safe in their roles, they don't feel that there's leadership within the team, you're going to get rid of things. So these are serious, very serious concerns. But my underlying issue, as a corporate parent, to which every councillor is that we have a statutory duty to ensure that every child is looked after as best as we can because we are their parent. And I am concerned when I hear this much noise going on around me from a group of people who are dedicated professionals, gone into a service that probably doesn't pay them very much, that they are scared for the children that they are responsible for and how we take this forward. So, not only do we need an extension, we need to make sure that the people who go out to work each day feel safe, because at the moment that was the other message that they gave to me this morning, is they don't feel that they are going to be able to build relationships up with key children. And you know, and I know from going to corporate parent conversations with looked after children, their biggest gripe is that they have one social worker after another, after another, after another. And after 10 years of 10 numbers of social workers that they've seen, they have no trust in the system. And if we are to support that group, which we are meant to as corporate parents, then how do we work today to ensure that this piece of change actually motivates the staff in the room and supports the young people who are the most vulnerable in our society? And I am disappointed by the process to date from all of you.
Thank you, Joanna. I don't know...
I have questions from Councillor
Liz Hardman.
Liz Hardman, thank you. So, I mean, I know I've made a statement. There are lots of questions around that, but it's not good enough. Councillor Hardman is equally upset.
I'm aware. Can I ask Paul May to respond to your statement, and then we can come on to Liz's questions then?
Chair, I think it's acknowledged that this is a consultation process, and we're going to take views of the staff in that consultation process. That's why you do a consultation process. As an elected member, I will then make sure that we listen to those views. I will work with the director and Darryl to make sure that we actually come up with the best solution for not only the staff, but most importantly for the children that we all serve. And under those circumstances, if we've got to change what we're doing, well, we'll change it. If we've got to actually implement it, we'll implement it. But what we do recognise is that we value our staff, we highly value our staff, and we will continue to work with them. And if it hasn't worked that well at the start, then we will continue to make sure we try and make sure that we deal with that better, and we'll provide more consultation with the staff going through to make sure they actually do feel engaged. This isn't doing away with it.
I'm sorry, can you sit down, please?
Been obliterated. The people who have created the team to make it the way it is are being made redundant.
There is more that will be being said by Cabinet member, by officers, and I absolutely do get that this is it's a very difficult time for everybody, and I think we're trying to find a resolution which will not be something that we'll be able to find in this meeting, but this is part of a process that hopefully will draw to the right conclusions sooner rather than later. Darryl, I know you wanted to speak.
Thank you, Chair, and thank you, Councillor Wright. There's absolutely agree with the sentiment around our commitment as corporate parents and the very strong messages that children who have been in our care and our care experience consistently have given about the changes in working. And that's one of the drivers, as the Director of Children's Services said in her comments a few minutes ago, in terms of the national government reform, about how we reduce that and also how we shift resources and interventions into earlier intervention. So, in fact, over time, there are fewer children coming into care. And I also want to belatedly, I think I had a chance earlier on, to thank Mark for his contribution, both in terms of the debate today and as a volunteer to the Connecting Families team. As an officer group, this is an important conversation, but we're also just to acknowledge, Chair, that we're in a slightly difficult conversation here because there's been a reference to the recent ACAS talks and also to a formal consultation that started, neither of which I can comment on in this forum at the minute, which is why I think Councillor May's tried to be pragmatic in suggesting a full briefing in consultation with yourself. These are things that we should be having a conversation about, but because we're in a formal consultation, we can't do it in this forum. It's a period of consultation. We need to listen and then come back with some proposals and decisions. And I had the privilege of being part of the recent conversations with Unison colleagues and ACAS. I think our joint statement was that those were constructive and positive, and we'll hopefully come back together again sometime soon. But beyond that, I can't really comment at this point, other than welcoming the opportunity to have that briefing as soon as possible.
Thank you, Darryl. Let me just check my list, Joanna. But you could be. You're now going to be Liz Hardman.
I am looking at Liz Hardman's questions, and they are clearly, quite clearly linked to the strike and the strike action. So I actually think that it would be better, they're four very comprehensive questions, that I send them now to Democratic Services and that we have a response by the end of the week for those, because I do think that's an important way to go forward. But going from that, Councillor May, is the Cabinet 100% behind what the officers have done, or have they asked them to restart the official consultation linked to redundancies and employment law once it's became fit for purpose?
Chairman, I don't think it's appropriate for me to answer that. That's a legal question that's been asked, and it's about the role of councillors in terms of a process that is an officer-driven process, and I would take advice before answering that question.
Perhaps the answer could be incorporated into the responses to Liz Hardman's questions. Thank you. David. Oh, sorry, Darryl. In fact, Darryl, I don't think you've introduced yourself yet.
Apologies. So I'm Darryl Freeman. I'm the Executive Director for People Services. So just going back to Councillor Wright on the timescale for Councillor Hardman's questions, we will absolutely do what we can in the spirit of transparency, but I also want to say, out of respect to colleagues who are in dispute with the Council and to Unison colleagues that we met under the auspices of ACAS, we also agreed jointly that the discussions and the details of those discussions remain confidential. So again, I haven't seen the questions, but we will do what we can. But I also wanted just to highlight, we've entered into a confidential agreement about the conversations that we're having at the minute, so I'm absolutely duty-bound to not break that confidentiality out of respect to the union colleagues. But the questions, as far as they go, I will answer to the best of our ability. Yeah.
I appreciate that, but then going back to the question that I asked in January, and I'm sure Liz Hardman would happily ask this too, is do you see that your staff are remaining motivated and committed and passionate to their jobs?
I think it's clear in the room there are some of our colleagues who absolutely feel angry and upset at the moment, and I think we need to recognise that, and we need to look at the communication and the conversation that we need to have with people. I see groups of very motivated staff. I see groups at the moment of unhappy colleagues, and I think we can't deny that. We just need to recognise that and work with that. Yeah.
I do hope that's on the minutes. Thank you.
Thank you. And there is a commitment to do that. Thank you. David.
Thank you. So in our slide deck, we've got a lot of information on EHCPs, etc.
David, sorry, we're still on this item?
Yes, it is.
So not the full Cabinet Members' report
No.
yet? Okay.
And the percentage of EHCPs issued on time under 20 weeks in 2025 was 19%. So my question is related to that. In this process, have we looked at all the statutory targets that we're supposed to achieve for our services and for our residents and their families? And will we be meeting those, improving where we are, or even bettering the standards that we're going to achieve, that we're supposed to achieve with some of these changes?
Jean.
Thank you. So the part of the directorate that is subject to these changes is the children's social care side, so children's services. The education side, where the HCPs form part of their work, that change is happening later. So it doesn't form part of that. But of course, in more general terms, we have to be very mindful about adhering to requirements in terms of key performance indicators such as visits to children, assessment timescales, making sure we have child protection conferences within a certain timescale, and all of those feature in the same way as part of the reforms as they do now. So there is no change in relation to those expectations.
Thank you. No change or an improvement?
I mean, no change in terms of the legal requirement, and of course we'd be looking to an improvement, with the ideal that as we turn our focus more intensively in early help and prevention, early intervention, that you would see a reduction in some of the statutory interventions that we have, such as child protection conferences, children in our care, and therefore you would see a real improvement in those children's circumstances.
Have we modelled that? Have we modelled that? Do we understand how these changes will impact?
So we have modelled the service. So we undertook a great deal of demand analysis, caseloads, workloads, and we have modelled the service on the basis of a caseload for social workers and family help workers. That is in keeping with good or better local authorities, and that is our ideal is to get to a situation where workers are working with a maximum of 15 children. There are some teams that will work with less than that in terms of individual workers, so it's slightly different for some teams who work much more intensively with families, but we've been modelling it on what is a reasonable and realistic case load for social workers and family help practitioners to hold.
Thank you. Do we have any more questions on the statement that Paul made in connection with the consultation? Eleanor.
Side of the coin, looking at it from a counsellor's point of view, I was very, well, I was quite frankly upset. Because a social worker told a client that she didn't see that the counsellor should have any role in a particular in a case. It was nothing to do with us, and she didn't seem to be at all aware of the whole concept of corporate parenting, which Councillor Wright has explained. So Councillor Hughes and I, who are both involved in this case because of residency and where the child was at school, wrote to Suzanne and asked if all social workers could be given some, not wanting to pick out this particular individual who was relatively new to the service, if all social workers could be given some training and understanding in what corporate parenting is, and secondly, what a ward counsellor's responsibility is to a child resident who's in some sort of difficulty. That was 3 weeks ago, and we have not received any reply, and I don't know how that could be or why that could be, unless the senior person who I emailed is on a, well, I don't think she is on a work to rule, but is under some terrible pressure or something. But I would like it on record that it would be a very good idea if we could have social workers fully informed of what our role is, and we had more information about what our expectations can reasonably be of them, who generally, I would say, are very overworked.
Thank you, Eleanor. I'm sure officers will pick that up for you. Perhaps you could send them the details so they can be very clear about exactly what the case is that you're referring to.
Reasons of confidentiality, I can't be more specific.
Not here, but I would imagine you can be slightly more. Anyway, I'm sure Jean will pick this up and outside. So I did see that Phoebe's light was on. Is that because you wanted to speak, or? Okay, right. Any more questions on the consultation for now? Councillor May?
Can we just be very clear? Can you send that an email through to Phoebe about that so that she can deal with that individual case? Because as councillors, we've got to be very careful not to interfere in the proper process of officers in the council. And it's really important that we try to recognise and respect the role of councillors in, of officers in this council.
Thank you. And now we'll turn to the rest of your report, Paul.
Thank you, Chair. Can I just start off by talking about something that's not in my report, and that was the planting of the yew tree at Alice Park, because I think it's very easy for us to forget that we are talking about children, and that was a significant commitment that we've given to children who have been in our care in Alice Park, which is a part of Bath. And I want to just try and level the tone down a bit, and thanks to Councillor Wright for all the work that she did to actually set up that event. It was really good, and it's fired out to children in care, both in care and care experience, that in fact they are really important to us. And I think it was really nice. So I just wanted to start off by saying that, perhaps just to tame the tone a little bit of this meeting. Thank you. And I also wanted to echo your thanks to Councillor Wright as well, because I think that was a very good thing, nice thing to have done, and I think it's given a real focus as well for our care experienced young people, as well as for those that are looked after. So thank you for doing that, for seeing that opportunity and seizing it. So moving forward then, Chair, there's been a significant white paper that's been issued around the statutory override that the governments have actually implemented in the past around SEND and the overspends on SEND that have been happening up and down the country. And they've made it very clear that, subject to us putting in a reasonable submission, that they will then cover 90% of that statutory override, which I've reported on a fairly regular basis to this committee, that it's somewhere in the moment in excess of £30 million. But that is going up every year to the tune of something like 10 or 11 million pounds. So they've covered it in terms of up to 2026. but then that leaves 27 and 28 when the government is then taking over the financing of SEND. Going back to the earlier question from Councillor Harding, the department is very clearly into social care and education, and SEND is the education dimension of the children's services. So it was good news because there was a national threat that something like 80 or 90% of local authorities would go out of business if they actually had to pay back that statutory override that's been there for a number of years. And it's a problem that the government have had, and quite clearly if you just left it going on and on and on, it would get to the point where it would be a major issue. And you're talking about billions of pounds that the government have had to put in to do that. I think it's good news in many respects, but we've still got to make a submission to the government, and it's very clear that the Department for Education now are actually working much better with local authorities than perhaps they have done in the past, and I think that's really good news moving forward. Part of those proposals is that safety valve has been stopped, and if you remember that we I think had a number of £1 million which we were expecting to get from safety valve. So the pressures from safety valve are still there, and we've still got to try and get the way forward. But one of the key issues around that was the creation of a free school up at Culverhay, and under those circumstances we were given a deadline to make a submission of whether we would take money to mainstream children into local schools, or indeed whether we wish to carry on with the proposals for a free school at Culverhay. And officers have looked at that in great detail, and we came back with the conclusion that we would like to ask the government still to fund that capital scheme up at Culverhay, which is so important, because in terms of our override, statutory override, something like £4 million of that every year is as a direct result of the fact we're having to send children outside of the area. And it's also about the not only for the, if you like, the cost of sending children outside the area, but also the impact on those children and the impact on those families. So it is really quite important that we've actually now got that approval now moving forward. The government made an announcement earlier on this year very clearly saying that they were going to be funding those types of schemes. So we've just got to now carry on working with the Department for Education, who've actually supported our concept that we've got to get this. And now we're talking about the design that will take place and when that design takes place. The other part of the alternative was the alternative provision, which we'd made temporary arrangements up at Abbot Alfred's school, which is in, where would you call it, Western? No, it's not Western. Lansdowne, I think. Lansdowne is a fabulous school which has closed, and it has the ability to be able to be adapted a bit more to take alternative provision there, and it has the scope to be developed even further in the future. So I think those are the big issues. On the SACRE side, I'm assuming that I've got Owen here, but also if Councillor Jackson wants to make comments, I'll be very welcome to pick that up to move forward. And I think at this stage, in view of how long the discussions have taken, I'm more than happy taking questions, Chair.
Perhaps we'll start slightly at the end, and I'll ask Eleanor to make any comments that she wishes to make about SACRE right now, as you've led her through that.
That's very kind of you, Chair. I did actually prepare a statement because I didn't know I would be subbing for Councillor Mansell when the report originally came out. So I wondered if I could just deliver the statement, and in particular, as part of that, I wanted to pay tribute to the support that we had from yourself when you were the Cabinet member with this responsibility, and what we now have from Paul May, Councillor May, has really been first class. And it's nice, we have so many problems in the Baines world and the residents' world, but it's nice from time to time to come across something that's really working well. Of course, we want it to work better, and there are big changes coming in RE. But, you know, it's nice occasionally to give ourselves a pat on the back for something that is a success, but we could make it better. So,
I'll let you read your statement. Is it 3 minutes long?
I hope so.
I look forward to it.
Sorry, I'll just have to change glasses. I don't know if you're going to put the timer up, but... right. So, this is the annual report of the Select Advisory Council on Religious Education for 2024 to 2025. And I hope you've all done your homework and read the report. Seriously, to quote from the Hebrew Scriptures, O Lord, teach us so to number our days that we may receive a heart of wisdom, which is Psalm 90. And this verse from the Hebrew Scriptures encapsulates what the annual report is about. Looking back, it is plain that we have achieved a considerable amount, but navigating the proposed national and regional changes which are coming is another challenge, and ensuring that every Baines child receives high-quality RE, an appreciation of traditions other than its own, as well as the tools to develop their own spirituality and moral standards, will be a challenge in the coming years. The report describes, sorry, I'm going to need more light. It's glaucoma, if you're wondering. And ensure it to develop there will be a challenge requiring wisdom. The report describes our monitoring role and the difficulty of defining collective worship and assemblies. But the important thing is that we work together in the community in the service of each other. And I think we've achieved quite a bit on collective worship, actually. Looking back, I think I can claim a little credit for today's proceedings. When I joined SACRE, the annual report simply went to the officer responsible for the SACRE and stayed there. There was even a debate a year or two later as to whether SACRE was an outside body, as its legal status is unique. We are required to have one by government legislation. It's not subject to proportionality rules, and that was what the debate was about. Now we report to this panel, the Cabinet member and his predecessor have been most supportive and showed a great deal of interest. And it seems to me that our engagement with schools is a lot better too. We even winkled a bit more money out and were able to do more work in supporting teachers and preparing material. And it seems incredible now. There was a great controversy about whether there should be a link from the Bath-Nest website to the SACRE website. But now, as you'll see from the report, we're integrating our pages in yours, and we feel fully part of the work of the Council, apart from our own independent work. We just need to sell ourselves better so that members in the faith communities can appreciate what we're trying to do and find the representatives we need. The vacancies are listed in the report. So the challenges are defining what so-called British values are, which the government wants us to emphasise. I think they're derived from Western European Enlightenment, post-Enlightenment standards, but I'll refrain from giving you a lecture on that. I can do it at a later date at a special meeting. It concerns the question of whether RE should become part of the national curriculum. At the moment it isn't, and whether it should be placed alongside English and maths. And we've also put quite a bit in the report about the need to encourage academic studies academic study, the transition from religious education and understanding what's going on, and proper religious studies, A-levels and GCSEs, and you've got the figures in the report. And this is going to be a challenge. And the other question that we will have to address, we're in the middle of working on a new agreed syllabus. The government is indicating that it is consulting on whether we should have one national agreed syllabus or whether it should remain the responsibility of the local authorities and be locally customised. Just to give you an example, when I worked in Derby, the agreed syllabus had a very strong content on Sikhism because we had there the largest Sikh community in Europe and lots of Sikh children, and that was utterly appropriate that should be. But I have to say, with respect to Bath, we wouldn't need that kind of emphasis. So the other thing which the government is strong about, and we are strong about, whether it's a national or a local level, is the right of every child to have the best quality RE possible. It's unfortunate that many adults have got a recollection of something not very well delivered that was just singing and a few parable stories, and that was it. We want really top-class understanding of the six or eight, it depends how you count, main world base and of local traditions in the pagan tradition, and what I've often wanted to work on but not had time yet and don't intend to retire from the council yet either to do it, African traditions and the whole Rastafarian Fairfield House kind of thing. And finally, we've done a lot of work, and I hope we'll continue to do it, on Holocaust Memorial Day and how to teach the Holocaust in schools, and I think that's really all important. The success, of course, also rests on the fact we work in partnership, especially with the Bath Faith Forum, Interfaith Forum, which is actually, of course, extends to the whole of Baines and a bit wider, and their continual drive has really made us even stronger, given us a very strong foundation. So I'd like to thank the existing officers who are working with us on Sacre, and the office bearers, especially the chair, Jane O'Hara, and Keith Burnett, vice chair, and Dr. YK, who's the other vice chair, and indeed all those who turn up faithfully for meetings, whether actual or on Zoom, on Teams. So thank you very much for listening to me. I'm always happy to answer questions, as they say.
Thank you. Well, I'm not sure, because this was a statement made within the context of our debate, whether that is a question, something to receive questions for, but I know that Barrett wants to either ask a question of that or maybe of the Cabinet Member. Don't forget, this is the Cabinet Member's report.
That tells you how well we're progressing, that it's become part of his report and is adopted, and we appreciate the support.
Absolutely. Barrett.
Chair, I'd just like to put on record that whilst there seems to be an emphasis on religious education, we must recognise that many people have no faith, and it is extremely important that whilst we nurture people with faith, we do not thrust religion down people who do not want to believe in any religion. And it is really important to have their spiritual development enhanced and encouraged, but not necessarily say you need to have a religion.
Absolutely, Barrett. I think that is a well-made point. I know that on Sacre there is a person representing the humanist point of view, but and I'm sure that the Sacre body will be taking on board that point as well. May I just turn back to the broader Cabinet Member report, though. So other questions on that? Michael and then Joanna.
Just before we do, can I just take the opportunity to thank Olwen for her commitment that she's been giving to Sacre. It's been really important for me that we actually have built those links over a period of time. And don't forget, the role of education is to try and educate people moving forward in their lives. So it is a really important issue. Sorry.
Michael?
Yeah, I've a couple of questions actually. One regarding the investment in SEND that's coming our way. I'm thrilled as I am that we're looking at developing Culverhay School as for special needs. So my concern is to make sure that the North East Somerset doesn't get kind of ignored or forgotten about in terms of extra investment, and that what plans might be taking place in order to support more improvement in the North East Somerset. And I speak obviously having a special school or a nursery in my own ward who do work with children with special needs as well, and whether we can be talking more to them. Another, the lady who runs that particular, the Free Rangers Forest School also is a very good mouthpiece for nurseries across the whole of the Baines, and how we can involve her more in thinking about how we can invest more in supporting special needs education in the North East Somerset area.
Thank you, Chair. The simple fact is the new free school, when that's provided, will be providing the services for children across the whole of Bath and North East Somerset. The specific issue that Michael's raised, I'll follow up with him separately outside of this meeting, but the point is that we will be able to provide for most of the children, not necessarily all of the children, with those special needs. Because within the new white paper, they've identified children at different levels, which they've called Target, Target Plus, and then the special education needs. So it's going to be more refined in the future, and we're then going to be looking to different ways of actually being able to provide mainstream through schools, but also through our contracted other providers, early year providers as well. So it is something that's all going together, and it is important that we actually do recognise that often children who have got educational needs also have social needs, and making sure that we join it all together as effectively as we can moving forward. So thank you for the offer, and I'll take that up outside of the meeting if I can, Chair.
Thank you. And just a follow-up question. So the SEND provision on the Culverhay site, can you just remind me what the age range is for that school?
Provided across all the statutory tool age, so 4 to 19.
That's number 4?
Yeah.
Okay. Thank you. So the point that Michael was making about early years provision is well made then. Joanna.
Thank you, Michael. I wanted to essentially follow up on that key issue. It's really good that we're getting the provision at Culverhay, but equally, even if you not live in North East Somerset, or you live in the Culverhay area, in terms of the Lambridge and young people who live on that side of the city, the biggest issue is that lots of young people have to travel distance every day to get to placements. So it's fantastic and well done to the team for getting the Culverhay delivered. That's an absolute round of applause. But what are the long-term plans to supporting young people? And I certainly know I spoke to a resident in Lambridge who said she could count 54 young people just where I live that were having to travel for hours every day. So I guess my question is about, we can't sit where we are, and I would also then add in, just picking up Radio 4 Women's Hour, they are onto this SEND issue just literally nearly every week and have huge call-ins on this. It was quite clear from listening to women especially who phone in and speak on that about their concern is that although they are pleased that the government are making these changes, they still feel that there's not enough information. And the information, and I think I brought this up last time, is that what happens when young people go to mainstream schools where the mainstream schools aren't set up. And we already know there's a funding crisis in mainstream schools, and the amount of money the government's saying that's going to go into mainstream schools is not going to overcome all the issues with all the actual needs of some of those children. A lot of those children don't know how to get to school. Therefore, will schools be penalised because those children aren't attending school, which is the system is presently in the mainstream schools. So there's so much going on here. I appreciate you can't answer all of that, but there seems to be, again, like with all of these things, change is coming, and we do need change, but how do we take communities with us? And also, I am concerned that this scrutiny panel does not get any oversight of the travel to school budget anymore, or what that looks like, and that's just been shifted elsewhere. So how do we bring those things together? So I guess my question really is, what is the long-term plans for helping young people who can't just get to Culver Hay?
I'll try and answer, because I think there's two elements of your question. One is about the information, and increasingly we're working what we call Better Together, where we're pulling together the parent carer forum, Sendias, etc., so that we can actually improve the information we make available for parents, because the system is difficult to navigate at the moment. Even if you are in the system, it's still difficult to navigate it. And the director and I have met a couple of people recently, and we've listened to the problems they have in terms of how we communicate moving forward. The issue around home-to-school transport is, in this authority, it's a large figure. It's something in excess of £11 million, but it's all set down by legislation. And one of the things I think that's probably going to come out from the white paper is new rules around how home-to-school transport, because it is an issue up and down the country about that. And in particular, I just made mention earlier on about if we can cut those journeys down and they can stay with their families a bit more, then it's going to be better for those children if we provide free school in Culver Hay. So it's never going to be perfect, and parents have got lots and lots of worries. But we, on a regular basis now, are talking about how we can engage and make it better for parents. My big worry, and we haven't ever really been able to address that, is the children that come into the system with the current system around EHCPs, is if they're not successful, how do we provide the support for those parents? And I think that's probably the subtlety of your question to us, Joanna, and that's something that we have to be thinking about in the future. But the government, I think, is making real improvements in terms of how they're dealing with this major issue that's been there for a good number of years. You often hear it said the system is broken. Well, it is broken, and it's really difficult. And later on the agenda today, we're going to have the presentation around EHCPs, which we'll hopefully we'll actually get time for. So that's not a simple answer to your question, but hopefully the other thing that we have done, because it is a major issue in Bath and North East Somerset, with so many schools being in multi-academy trust, is that we've set up a SEND AP team, which actually has been developing the ability of those schools to be able to deal with SEND issues for children, and to identify at an earlier stage, which is all part of Families First, where we can actually get to children as soon as we can, rather than they then come into the system. Once they're in the system, it's too late. And what we can do is, if they've got serious disabilities or whatever, then that's fine. We can always will be expected to be able to deal with those. But if it's social, emotional, mental health issues, we should be able to do more at an earlier stage.
Can I just ask one more question on that? Because essentially the multi-academy trusts are not within Baines, they're separate. Yet this is a piece of work that you're going to have to do with them. But how would this scrutiny panel ever get sight of sound of that? So how can we bring them into this room?
That's a really good question. One I've discussed with the chair because they're monitored by the Department for Education, and once a year we have the Department for Education coming along, but we never actually, and the reason I put in my report a little bit around what multi-academy trusts we've got is the fact that we as councillors with so many and I'm going to go on a political statement here, but with so many schools in multi-academy trusts, that we are still accountable to the public about education in Bath and North East Somerset, but we don't actually run it. So it's a different skill, and it's an issue that the chair has raised with me, and I've raised with the officers, is how do we get the accountability for performance across Bath and North East Somerset. The good news is the performance is good. But
going forward with SEND young people going into these multi-academy trusts, we need to have that conversation. So I am looking at officers, how do we get them into this scrutiny room? And that should be something that we work towards.
And I'm not going to give you a definite answer today because it isn't our responsibility to make them accountable, but we can make the Department for Education be accountable to us. And I know the chair, and we always invite them in here on a regular basis. But whether that can be changed in the future, we have the School Standards Board where we actually work with the schools around the standards, but that's a closed meeting. It's not available to councillors. So there are different things that we could probably be thinking about in the future.
And just so you're aware, it's an issue that doesn't just affect this area, but obviously it's a national issue, and that question has been going up through to government ministers as well. So, because it is an important question, and I'm very happy to up our invitation frequency to the director to come and attend this meeting more than just once a year. And we'll see how that fares, because obviously now that all schools have to be within multi-academy trusts, that's going to become even more of a necessity for all authorities as well. Like you want to say something?
No, I think the only thing I would add is increasingly Ofsted is now going to be looking at multi-academy trusts, and I think that's a major step forward because the accountability for multi-academy trusts has been really quite diverse. And I think it would be something in the future where Ofsted will be looking at their inclusion policies and a whole range of issues.
David.
Thank you, Chair. So we have in the past had some multi-academy trusts may be less inclusive, if you just hinted at, Paul. We've also got falling school roll numbers generally. And we're seeing the trend or the push for more children with special educational needs to go to mainstream schools. So that seems to mean that more multi-academy trusts and schools will be dependent on the SEND funding. Do we see this as a threat, that kind of combination?
I'll pass that over. I've got a political answer to that, but I think I'll let Chris answer the technical question.
Just so I'm clear, to clarify that, the concern is that the schools will be more reliant on SEND funding because they're not getting the pupil yield that they're concerned around that. So in Baines, like a lot of the local areas around us, the pupil growth hasn't been as strong as what was predicted, and we do have some areas where some schools are not getting the numbers of children that have come forward. Some schools and trusts, therefore, do come to us to say that they do have spare space and capacity within their buildings, and if they can, they'd like to develop SEND provision. So sometimes it presents itself as an opportunity that we do actually have more space to be able to develop either inclusion bases or resource bases or support which schools think they can provide to the community around that. I don't necessarily see the SEND funding being a threat, but what is a concern for schools is generally footfall and pupil numbers, because ultimately that's the income for the school to be able to run.
And the other thing is the government have made it clear that they will be in mainstreaming into schools, that they will then be providing additional resources to build up the capacity in those schools where they've actually taken SEND children. So it is something that is going to be developed as time goes on. But, and it isn't, no, it's a big but, not all children can go into mainstream schools. And that's the reason why we pushed and pushed and pushed around Culverhay, because that is a specialist provision for the children who really can't be dealt with in mainstream schools.
Any more questions on the substantive report? Eleanor.
I mean, I welcome the fact that the Culverhay development is going ahead, and I believe also that the Fossway School, having ended its residential provision, is also planning to expand. But I was just wondering what can be done about the fact that the schools are unevenly distributed. So if you're, well, they probably don't think so, but in Keynsham it seems to me you've got more accessibility to special needs schools than, say, Midsummer Norton, where what can we do about cross-border collaboration? Because they're part of the fact they're all under these multi-academy trusts. They're also cross-border, and the Fossway School is actually sort of run from its main headquarters in Shepton Mallet, and you've got children coming back and forth. Can anything be done to even out the distribution of accessible schools? That's the first question. Second thing, down on the bottom of page 23, there's a statement about information on academy schools in Baines. It's very brief, but the same sentence comes twice. In terms of secondary schools, the Midsummer Norton Schools Partnership has the highest number. The question is, can we have a bit of amplification in the next report, a bit more about these multi-academy trusts and the implications? And finally, the Culverhay School is an excellent idea, but there happens to be a Hindu temple there. Could there possibly be some way of helping this important community facility to relocate somewhere appropriately? I'm going to give Dr. Pankania a list of redundant churches, but that mightn't be the best solution or the best locations. So have a thought, please.
Chair, can I think there's three parts really. Is the cross-boundary issue around multi-academy trusts. In my report, quite clearly it says that secondary schools and primary schools pick that up. The Hindu temple almost certainly can be retained on the Culverhay site, and we're in discussions with them about how that can be done. And I think the issue about, this is the first time we've seen anything about academy trusts. I think I wanted to start the conversation because it is something where if we wait 6 months to see the Department for Education, then the committee then can only have one go at one person. It just struck me that we should be actually putting in a bit more information. So I'll answer Councillor Jackson's question in a very, very simple way. I think it's really important that we do actually provide more information. We haven't listed all the trusts. We used to, as a committee, get the information around performance at primary level and secondary level. We still get a performance report, but it would be handy, I think, that we actually pull it together more around education moving forward. So I think it's a good question. Thank you, Eleanor. And we will try and take that forward in the future.
Thank you. So I'm not seeing any more hands going. Oh, sorry, Chris.
Just to say, I thought I put that on the agenda for future meetings.
About multi-academy trusts?
Yes. And
Yes,
how
and-
they are spread out.
Yes.
Yeah.
I think you did too. The point that Eleanor was making was also about specific SEND provision and how that was spread across the authority. And it was, you were suggesting it was uneven, which obviously doesn't help with homeschool transport, etc. as well. So I think that point will be picked up too.
It's quite an important point. We found it with the Silver Street development in Midsummer Norton, but not just there. We get from the education team an estimate of how many school children will come into the new houses. And it always seems, the presupposition, for instance, there will only be one SEND child in the new Silver Street development. I think it's just not what we find on the ground with young families moving into the outer extremities of Baines.
Chair, that's a much wider issue.
Formula for calculating how many children will be generated by the new housing estates that are going to come in.
Perhaps we could have that in your next update, just a reflection on how relevant that particular calculation is now, and should it be being changed?
I think that's something that's going to be for the local plan to be considering. It's something that the Health and Wellbeing Board have picked up. 27,000 houses, you're probably talking about, what, 30, 60,000 extra population, and you're then going to have issues around roads, health, a whole range of things, but it is also going to have a major impact on social care. So I think it is important that we actually try and get that message over. I'm not certain whether that's for this committee. I think that's mainly for the planners to actually take up. But through the Health and Wellbeing Board, we have challenged quite clearly the planners to be thinking about social care and the SEND issues, because I think that's really important. And just before we finish my report, Chair, can I just take the opportunity, please, to announce or thank Phoebe for stepping in to help during the transition after Lee left us. She stepped in, and I think it's really important this committee actually says a big thank you to her for what she's done, because I think it's been important that we actually do thank her for doing it. And we've got somebody coming in now permanently on the role of Assistant Director, and that's Paul Shallcross, who's coming from Gloucestershire. Very, very experienced person, and he'll be joining us soon, Jean?
Mid-April.
Mid-April, yeah. So thank you very much, Phoebe, for the support you've given us. It's been really appreciated. And you're with us, and you'll stay with us, and we'll be helping you develop as time goes on as well. So thank you very much. Thank you, Chair.
Thank you, and a thank you from this panel as well for all the help and support that you've given. Okay, any more? Chris? No? Okay. Oh, put your drink down. Okay, right. We now move on to the ICB Baines and Swindon and Wiltshire's ICB report. And before Lucy sort of draws out anything else that isn't in the report, I just wanted to congratulate Lucy on her new position. So Lucy was already a familiar face to this panel, and is now our representative on the ICB as the Place Directorate for Baines. Is that correct?
Right, thank you, Dina. Yeah, that's correct.
Thank you. Right, is there anything else you'd like to add to the report?
A couple of bits I wanted to draw out. As Dina said, I'm Lucy Baker. I'm the Place Director for Baines, sitting on the new executive of the ICB cluster. I also am the Commissioner for Children and Young People across the new cluster. So for children, you'll be seeing a lot of me. Thank you, Councillor May. In terms of just a couple of bits I wanted to draw out, if I may, Chair. Firstly, just to say the ICB is going through a significant restructure. Our staff consultation will be launching on March the 18th, and I'm happy to bring back further updates as we work through that process. It will be a 45-day consultation. In terms of for this particular committee, just to draw out in the update, you would have seen the ICB 5-year strategic plan and an update on neighbourhood health. And through the Health and Wellbeing Board, we've also acknowledged that we must ensure that we are continuing to focus on children and young people as part of those agendas. There has been some focus on adults for the neighbourhood health, but really importantly, we've drawn out that we need to pivot into children and young people. I just wanted the committee to note that there has sadly been a delay in the opening of our new inpatient learning disability unit in Bristol called the Kingfisher. That's due to a flood. We are waiting to hear about the timeframes for that, and I will bring an update back to the Adult Overview Scrutiny Committee on that matter. Just a couple of other updates we were asked to bring previously around dental. We were asked to update around whether dental practices were commissioned to promote the supervised brushing scheme. They are not, but we've agreed to work very closely with colleagues in public health to look at what opportunities there may be to do that moving forward. There was a question from a committee member around EQIAs, those assessments. They are not readily available, but if any committee member would like to see one, we're very happy to share them on any topic. There was a request from Councillor Wright around termination of pregnancy data. I'd like to take the opportunity to apologise to Councillor Wright for the amount of time it took us to get that update, but it is included. And just to confirm, that is Baines, Swindon and Wiltshire data. It's not disaggregated down into Baines only. And lastly, not in my report, but just to update members of the committee, you may be aware of mental health provision via a service called 1112. That means that when you ring 111, there's an option to dial number 2 should you require mental health support. There have been some operational challenges around business continuity for that service. So the provider, AWP, have introduced some daily oversight, additional clinical and operational support to stabilise the call handler capacity. That means that there's no change to the way that professionals or the public dial into that service, and people can absolutely still use 1112 as appropriate, but I wanted to make the committee aware of that business continuity plan. And I'm working with Councillor Bourne to bring a further update to the next Adult Overview and Scrutiny Committee. Whilst I've got the mic, Chair, I thought it might be worth just me briefly updating on long COVID as the next agenda item. So apologies this has come to the children's meeting, but it was timely that I needed to bring it today. Committee members will note that this paper is asking 2 very particular questions, and I wanted to emphasise that no decisions have been made. The paper talks about potential changes to the way long COVID support is delivered by the NHS, and what we're asking for is feedback on whether those proposed changes constitute a substantial variation to services, and secondly, whether the proposed 4-week-long targeted engagement is proportionate. Any decision-making paper will come back to future meetings. Thank you, Chair.
Thank you very much, Lucy. Are there any questions around the ICB report? Joanna and then Michael.
Thank you and welcome to your new role. The sexual health information that you provided to us was, as you say, across the whole of that area. I just wondered what that looked like in comparison to another ICB. Is there data on a similar sized ICB that we could look at to see what those numbers were?
So we did some calculations to try and work that out. When you look at the figures for Baines, it's about 26.8%. The South West average is about 28%, and the national average is 29.7%. So that would indicate that Baines is just below the national average for that information.
Okay. I guess what's quite hard from that information is we're not hearing very much about how hard or how easy women are finding it to get to that point. And I wondered if there's any way of finding out that information.
So our lead midwife has done some work on that particular issue. What we've noted is that there's been a rise in medical terminations and a reduction in surgical terminations. And we believe that's because of the accessibility of such interventions. I think one of the things that I've been discussing with public health colleagues is some work that we might want to consider about promotion of emergency contraception, just to make sure that we are really clear with women what their options are. So Amy's here today and there are plans for us to discuss what we might be able to do. When we've done some work and we've done some engagement work, there have been no concerns raised about access, but it's something we're keeping a very close eye on.
I guess one of my questions would be was then in that is that there was like the older women, there were three groups. It's the one in the sort of 24 to 34, I think. They seem to be ones who are most using terminations. So I guess going back to what you've just said, do they have sufficient information about medical and support? And have we just missed that group of people and now they've moved into another space so that it's harder to reach them? And I just wonder if a piece of work needs to be done around that group of women.
So really happy to pick that up in our discussions with public health. Do you want to come in, Amy?
Yeah, I can come in.
Can you use your microphone? Amy, sorry to pause you, but just people won't be able to hear you online. I don't think even your voice will carry that far.
Great, thank you. So in Baines, contraception looks really good in some areas. So long-acting reversible contraception, LARC, our rates are really good. They have been for a long time, really steady. So I think that all women, including that age group, will get really good access through their general practitioners. We know that some contraceptions have been reducing, so EHC via pharmacy. That's not specific to Baines, that's in the Southwest and nationally. Therefore, recently, so in October 25, there's a new pharmacy, a new sexual health national pharmacy contract. That now includes AHC, so that's not kind of being commissioned for a local contract anymore. So there's things like that change, which will support access. I think previously, particularly for that age group, you know, busy women, often working with children, some of it will be about convenience. And actually, if you go to your pharmacy and they don't have EHC there, or you know, or kind of good signposting, that can be tricky. Where actually there's changes taking place both nationally and locally to ensure that access is good. But that's really important, obviously, across kind of different contraception methods. And then there are, in terms of signposting, so there's good signposting in Live Well, Safe Well Baines, but there's always more, you know, that we would be, you know, willing to do, and including engaging with workplaces, third sector partners to ensure that that information is out there.
Thank you. I just would like you to keep this on the agenda. I appreciate it's taken you a while, which shows that it's not been on the agenda, so we need to keep this on the agenda because it's important to an awful lot of women. It's their bodies. The other questions I have is you talk about the neighbourhood health plan and what are Baines' challenges. So I guess my question is, what are our challenges?
Thank you. So really happy to share with members a broader piece of work around the vision statement that was worked on a collaborative workshop that we held in January. That details some of the challenges that people put together, but just give you a very brief summary. There was a real recognition about siloed services. There was a real recognition about avoiding duplication, and then there was some very demographic conversations about what makes us Baines and what some of those challenges are. So the importance of Bath and North East Somerset and making sure we're looking at all of our populations. And then there was some information we looked at which was well known to some extent around population health insights. So what are the populations in Baines where we see more health inequalities across communities like rough sleeping or boating communities. So the presentation we have, I'm very happy to share because that goes into more detail.
And finally, my last question is on dentists. Thanks for the information so far. But as we've heard in the news recently, an awful lot of NHS dentists have given money back. And I just wondered, do we have any figures about how much money that we locally have received back from NHS dentists?
Thank you for the question. I don't have that information to hand, but I will find out and come back to you.
Thank you very much, Lucy. Next, I have Michael, and then David, and then Barrett.
Thank you. Yeah, I've got a couple of questions. I mean, one of the issues that you've raised is better use of resources for the BWS town going further, and I would fully support that. And also this a consistent digital offer, and I know it's been raised before, but I'm just concerned about making sure that all our users of the NHS system have access to digital, and if they don't feel left out. And I know that a lot of older residents may not have apps to be able to access services. And I'm still very concerned that as we move more and more towards digital, you're disenfranchising a lot of people that don't have access to the skills or the knowledge or even the interest in wanting to download an app to find out what's going on in their area. So my concern is, what are we doing in the plan to make sure those people are not forgotten about? And I'll keep saying every meeting I can, because I think it's really, really important. So that was one issue. Secondly, I'm just in following on from Joanne's question, is actually in terms of what the priorities are for the neighbourhood plan, and how can we feed into that, both as local councillors and possibly people involved in services that are working within the NHS. Yeah, I was interested in the communities that you identified, and obviously one of the first groups that you started working with was the kind of boating and Rumney community, and I'm just wondering what the other cohort groups that you are going to be targeting are, and whether we can support in that. Oral health, I'm just interested in which schools have signed up to the Big Brush Club, and can we as local councillors do anything to support schools in our local wards that might be involved with that? And if there aren't many schools in our ward, can we not be, is there a role that councillors can play in encouraging more schools to introduce that? And there was one more question. In the vaccination programme, I'm very concerned. I see that a lot of work has been put into making sure that care staff that are working in care homes were actually they've been encouraged to be vaccinated. But what's been done for a lot of the independent carers that are out there? Are they eligible for that kind of support as well? Because we now have more and more independent micro-providers that are providing an essential service in our community, and may not be on your radar in terms of making sure that they have access to vaccines as well, because they are doing a great work going in and out of houses all the time to support people.
Thank you. I hope I've captured all of those. So in terms of feedback, absolutely around the digital agenda, some of the work we're doing is looking at making sure that we are supporting those that are not digitally disabled, and that will form part of our neighbourhood plan. In terms of that neighbourhood plan, we will be holding a series of workshops from April through until May, and those will be well publicised, and we hope we hear from lots of communities about the sorts of services they would like and how they would like to access them. You mentioned the engagement work. We have done some work with veterans and the voting community. I think what we're really keen to do is align with our colleagues in the local authorities to avoid engagement fatigue. So our team will be working with, for example, the Community Wellbeing Hub to look at opportunities where they're speaking to local communities for our team to come along. So we're asking we're becoming more mature about how we're engaging with communities and doing that collaboratively, looking at the whole person, not just we're engaging on health, we're engaging on elements of social care support. I don't have the list of schools that haven't signed up to the Big Brush, but I will get that, and we would welcome any support with those schools to encourage them to sign up, but I will bring that back to a future meeting. And I will ask the question about vaccination. So we do offer vaccination support to a broad number of people, but I will ask that very specific question about the independent carer market. Vaccinations are available, but let's make sure that we've particularly looked at that group of our population because they provide such valuable support. I hope I've addressed all your questions.
Thank you.
Thank you, Lucy. Michael, can you turn your microphone off? David.
Thank you, Chair. A few questions about blood pressure roadshow and the dentists in work, and then I might come back on long COVID after Barrett.
There's a separate paper on long COVID.
Yeah. Your blood pressure roadshows visit Bath. How many of them visit the rural communities? And I guess I've asked this question several times to your predecessor, and it's always, yes, I recognise your challenge, but what happens? Similarly, I suppose, with the dentists' work, reviewing key populations, it's great. It's a proper dental desert. Lots of people can't access. But again, I would ask what work's being done with the rural areas, and can you keep me advised about that? Because I'd be very happy to help promote some of that work within the Chew Valley ward and the rural areas of Mendip, if my colleague would so wish. Thank you.
So in terms of the BP Roadshow, there are plans to expand that, and I will come back to you with when that's going to be done in the rural communities. Longer term, this will form part of our whole neighbourhood offer. So rather having very bespoke sessions, it's about health being more present in every neighbourhood. And that's the plans we talked about as part of the neighbourhood plan. But it's important we recognise all communities in the interim. In terms of dental, you're right, dental access is a really top priority. We have updated previously about plans around a dental bus to provide access more easily into our rural communities. I have asked our commissioners in dentistry to get an update on that. Happy to come to you directly with further information.
Thank you. So yes, and I know that I'll start with you when we come to long COVID. Yes, but Barrett is next on the ICB report, and then we'll go to the long COVID report. Okay?
Thank you. My colleagues have asked the questions that I wanted to ask, Councillor Wright, David and Michael. However, I'll just emphasise what Councillor Wright was saying. We really need to know the state of play with regard to the emergency provision of contraceptive services. I really would like to know how easily accessible it is, how user-friendly it is, and because terminations of pregnancy, in my mind, reflect a failure of that emergency contraceptive service. And I would really like to know that we're doing all we can, as well as can be, and that there are no hurdles for the emergency provision of contraceptive services. The second point, I know you can't answer that right now, but perhaps you'd come back and say, look, this is the state of play, these are the gaps, and these are the gaps that we wish to fill. So please come back at some other stage. The other point I also wanted to just add is in the similar light, contraceptive services should also be available for men, in that it's a two-way process. It's not only just taking the OCP or emergency contraception by the women. but, you know, an easy, safe availability of, for example, condoms is also a useful tool in both preventing unplanned pregnancies as well as sexually transmitted infections. But I wonder if you would come back and say to us, look, this is the state of play, this is what we're doing, and this is, these are the gaps.
Yeah, so just a reminder to the committee that emergency contraception is not commissioned by the ICB, it's commissioned by the local authority. So Amy, if you could update.
Yeah, and really happy to come back and give a fuller report. Just kind of briefly for now. So EHC, the local contract, gaps, definitely. And that we, as I said, we weren't unique. That was nationally and nationally recognised by that new national contract. We're not yet getting data in relation to that national contract, but we will be. So again, we'll be in a better position to update next time. Just wanted to provide a little bit of reassurance around what we've been doing recently. So we've been doing a young people's survey, an exercise where they go into pharmacies and ask various questions so that we get a good understanding about what service they're receiving, in addition to what we know they're providing, they're commissioned to provide. And we're just looking at the results from that. And then that's feeding into a bigger sexual health needs assessment that we're currently conducting, which is, to be honest, mainly focused on Riverside, but looking broader around contraception. So, yeah, I think we'll be in a good position to update you on what that's looking like, and also with data that comes through from the new national contract once we start receiving that. Okay.
Can I ask about the dental services?
Okay. Is this another one of a question that's already been asked that you're not going to ask?
No, I just want to just add to it, which is, I hear about your dental bus services, and again, childhood dentistry is really important. And I know you're doing work on, supervised toothbrushing, etc. But free and ready access to a dentist is just as important. And we don't want young children to be suffering with toothache, caries, and unable to access a dentist. We need to, again, have a piece of work. How do we solve this problem? Because it really is a problem. It is a problem that we haven't really addressed properly. Dental services on the NHS are few and far between. We need to look outside of the box and say, how can we address this? Because we need to address it.
Thank you. So I think as we've previously reported, we understand dental access is a top priority. It is a national issue. And as an ICB, as we go through our restructure, one of our priorities that we'll be continuing with is a dental strategy. So what is our local response to try and solve that issue? And I'm happy to bring any updates as we have them back through this committee.
Thank you, Lucy. Right. I think we're done with that. Oh, Eleanor.
Well, this is really on the question of the abortion figures that we've got and the figures for older women, which are clearly unfortunate, to put it mildly. But I was wondering, well, one, of course, being who I am, I hope that the lifting of the ceiling on the two-child family will perhaps be reflected in parents having the number of children they want, and that might, and not going for an abortion. But I don't know if we can correlate the data between the abortion figures for older women and diagnosis of severely disabled fetuses, tests that are now available, for instance, for Edwards syndrome and so on, might lead an older parent to think, I just can't cope and have an abortion. So can we get any correlation? And the other question is, could we in future also have some information about norovirus? I having caught it in the RUH a month ago, so we just don't hear now about this, and I wondered if it could be in the next report.
Thanks. So Amy and I will work together to bring some information back in relation to the queries. I just wanted to say that the data we have around termination of pregnancies from a health perspective is not great, that we've acknowledged. Also, there was a national abortion notification system that was brought in 2022, and that has some impact on data, but we will work together with the data we have to bring something back, but we may not be able to answer all of the questions. In terms of norovirus, obviously that's business as usual for the NHS. I would be happy to bring something back to the next adult meeting around the recent outbreak within the Royal United Hospital in Bath, which was, I think it's fair to say, unprecedented with the number of bed closures. But I think that's probably the most targeted way I can do it. If the Council would like any other particular information, I'm very happy for her to talk to me directly.
Thank you, Lucy. Right, I'm now going to move on to the next item, which is related, and that is the future of the BSW long COVID service. If you remember, Lucy put two questions to us. One is whether we judge this to change to be a substantial variation. Sorry, I couldn't read my own writing then. And is the proposed engagement proportionate? And so bearing those questions in mind, and also bearing in mind that if we decide that it's not a substantial variation, then we wouldn't expect to have reports coming back here. So if you want reports coming back here, then say it is a substantial variation, I guess is the steer from that. So, panel, do you have any questions around long COVID that you'd like to put to Lucy? And also, if you've got any views on those particular questions, then that would be also helpful. Barrett, did you want to start, and then and David?
I was going to ask my friend to start, and I'll follow.
Okay.
Thank you. You say that we're sort of unsure about the incidence of long COVID in your report, and yet there are some reports with respect to children anyway that's saying that long COVID is as common as asthma in the US. You also say in your report there's the awareness of the symptoms and impact of long COVID is relatively high across the wider public. And I'm presuming that's really driven by knowledge of people having an affected friend or friend of a friend. The COVID inquiry into long COVID, this basically highlighted the poor public health messaging on COVID, and a lot in particular with respect to long COVID. And it really highlighted that most people don't actually know where to get help to find out about long COVID if they've got it. So my concern really is that your targeted engagement is that the people who are using your clinic. Really. If we don't really know the incidence of long COVID, we're seeing rising rates of people claiming disability, etc., partly perhaps because of long COVID or other effects of COVID over the last 4 years or 5 years. So is the engagement process the right one?
Thank you for your question. So that was the aim of bringing this paper, to have that discussion with elected members today. I'm very happy to take that back around making sure that the engagement is meaningful for the whole population. So I do take on board your comments about the targeted engagement with people who have or have previously used the service. In terms of the volume of referrals, you'll note in the paper that we have seen a significant reduction down to around about 20 a month. That number was much higher previously, but I think it's important we acknowledge your very valid point about awareness of long COVID symptoms. So I will feed that back into the team who are leading on this. From a public health messaging point of view, we'll continue to link in with our colleagues, but I think it's important that we log around, is targeted engagement enough, and that's the query that I will take back. Thank you.
Thank you. Barrett.
Yeah, I thank you for your answers, and thank you, David. I just want to emphasize what my colleagues have already said, which is, with respect to SARS-CoV-2, long COVID infections, We are still in unknown territory. And because we are in unknown territory, it's important to keep our surveillance up, which is what are the emerging trends? What are the emerging signs, symptoms, and disabilities that come from persistent infections with COVID? We know, with SARS-CoV-2, we know that repeated infections is what we're all exposed to. What we don't know is what are the consequences following those repeated infections. What are the tipping points which make somebody who recover long COVID. We just don't know. So unfortunately, this is a huge pull on NHS resources. However, I don't think we can ignore it just because it is a huge pull. We need to keep a watchful eye and see what's developing, where the trends are going, and what can we do about it. I appreciate we haven't really got many solutions, but it is really important to keep that watchfulness because otherwise, as David has said, we know what we know, but we don't know what we don't know, and if you're not looking for it, we won't find it.
Thank you, Barrett. I think Lucy has agreed. Okay. Eleanor.
Well, as somebody who's had long COVID, I've reflected on this report quite a bit. And I was wondering if a possible solution E might be that embedded in the local health system, we should have the same provision, like we have a specialist GP for veterans, and if an ordinary GP can refer a patient who presents with war-related or veteran-related problems to this unit in the Riverside, whether we could possibly have a specialist person who could be rung up and said, I've got a patient here who's doing X, what's the solution? And they might say, well, we don't really know, but we recommend Y. Is that a possibility?
Lucy?
So, as I described at the beginning, this is about the engagement and whether this requires is considered to be a considerable variation. I'm very happy and will take the councillors' comments back to the team leading on this work.
Thank you. David, I think you might be the last speaker.
Thank you. I just wanted to check that this is just adults, yeah, this clinic, because there's no paediatric long COVID clinics across the southwest at all now, as I understand it.
So previously, children from this area were seen in the specialist COVID clinic that was run from Bristol Children's Hospital. I believe this is adult only, but I will clarify that.
Thank you, because it is pretty worrying that a huge proportion of our children are getting COVID once a year in schools with minimal prevention and no vaccination. We're storing up potentially serious trouble for a lot of people.
Okay, so thank you for your questions. Thank you for your answers, Lucy. I think, just sensing the mood of the room, that in terms of the unknown scale, I think we would like to see this come back again, which isn't quite an answer to your question, because I think it's hard for us to quantify exactly what is substantial when there are various factors that aren't known. So I think just to be cautious, then I think we'd like to see it again. Thank you.
Happy to do that, Chair.
Thank you very much. Right, we now move on to the next item, which is the it's the education attainment gap. And Councillor Paul May, would you like to just give us a little bit of an update in addition to anything that we've got in our report?
We'll deal with the report, Chair, but it's been an issue ever since I've been on the council, and there's been various initiatives carried out over a long period of time, and it's good to see Amy here as well, because it isn't just about schools, it's about the community and how we engage effectively with the community. But Chris is going to give you an update at this stage.
Thank you, Councillor May. This is a joint report prepared by myself and Amy McCulloch, who's in the room today. This is going to go through the academic results which we had for the last academic year, so I'll give some highlights of that, but I appreciate people will have managed to read through the paper. And then Amy is going to talk about the work around wider determinants, the part that the council wants to play in this work, and the commitment that we've got to our schools to stand side by side in helping them make sure that we are encouraging and supporting for the outcomes for some pupils to be much better. As discussed at this meeting before, the council no longer runs the majority of schools in Baines. They are not accountable to us, but we have a moral imperative and public imperative, and it's written into the work that we have to do as part of the statutory duties around the DCS to make sure we have good outcomes for all children. So we're absolutely committed to doing that and working in a really holistic way with schools. But if I can, I'll just give some highlights of the overall performance, because within that there are also some real positives in terms of outcomes for children in Baines. So the first thing to say is that pupils in Baines attained higher grades than regional national figures at all stages of their education, except at Key Stage 2, where attainment remained in line with national figures, and I'll say a little bit more of that in a second. In the early years, so the early years foundation stage, so that's the reception year in primary school, the percentage of children reaching a good level of development increased to 73%, which is higher than regional and national averages. At Key Stage 2, the performance of all pupils in their combined reading, writing and maths was higher this year, rising from 60% to 63%. That brought us in line at Key Stage 2 with the national average, which is really positive for Baines, because we haven't been at the national average since 2021. Before that, we were higher than national average for Key Stage 2, but we've dipped below that for the post-COVID years. So it's really pleasing to see that average go back up again and higher than the South West average. In previous years, what you can see, and what I should have said, is in this report there's a link to the Council's strategic Everton base around education. The information is derived from that. I encourage people to go and have a look in there. There is a lot of data and graphs and charts, but there's also some really good summaries that people can use to work through the education outcomes. Normally in that you would see an item on how much progress children in Baines make from Key Stage 2 to Key Stage 4, so primary school to secondary school. We haven't been able to report on that this year because those people sitting the exams this year did not take their Key Stage 2 examinations due to COVID, so that information is not there this year. Positively, Key Stage 4 attainment grades 9 to 5 and an attainment 8, though slightly down on last year's figures 23-24, is once higher than regional and national averages. So when children move from their primary age into secondary school, their performance really does improve and goes above regional and national when they sit those Key Stage 4 examinations. Equally, our A results in all measures were all higher than regional and national. One of the things that we've talked about at this Scrutiny Committee before is that generally girls are performing better in all key stages than boys in all subjects. But for the first time since 2018-2019, boys did marginally better in Key Stage 4's grade 9 to 5 English and Maths. However, girls continue to perform better in their primary Key Stage 2 examinations. Pleased to report that children with SEN support needs and children with those with education and health care plans performed better than national and regional comparisons in all of the key stages in Baines, so that's really particularly pleasing to see. In previous years, we've either just been in line with or just below some of those outcomes, so that's a really positive year and just worth marking. That is particularly in Key Stage 2 and in, for those children with EHCP, they did quite a bit better. So that's really positive and one to highlight. In relation to ethnicity, attainment in Baines is lowest in the black and other ethnic groups at all stages of education and remains below national levels at Key Stage 2 and Key Stage 4. In Key Stage 2, 53% of black pupils achieved the expected standard in reading, writing, maths. That compares to 63% nationally. So that is one of our gaps that we need to be really aware of in Baines, and that's been a trend here in Baines for a number of years. Coming on to disadvantaged free school meals pupils, so we did have a slight improvement in the Key Stage 2 outcomes in reading, writing and maths, moving up to 33% to 36%. That is a 3% increase, not a 4%. My apologies, it says in the report. So that's positive. We're saying a slight improvement in Key Stage 2. However, that remains significantly below what the national average is of 48% for this cohort of pupils, and is the main focus of our work, for me anyway, particularly working with Baines. Something different happens when our children move into secondary schools, so our disadvantaged and free school meals pupils, when they get into secondary school, they do better in relation to their progress and in their attainment than they had been doing in Key Stage 2. However, this year it was still marginally below the national average. Of course, we want it to be higher. So there's something really interesting about what happens for these children when they move from primary to secondary education in Baines. There's lots more I could say on that, but I don't want to take Amy's slot over, so I'm going to hand over to Amy.
Thank you. Thanks, Chris. So just a little bit of a recap. When I was here last year, we talked about the importance of work outside of education settings as well as within education settings to address the education attainment gaps, so what we call the wider determinants of this inequality, and that's where we presented research and a report looking at 10 kind of core factors for why we think we have this attainment gap in Baines. So over the last 12 months, we've focused on implementation against an action plan. So it's a 2-year action plan initially, but we envisage that being extended and refreshed as time goes on. We've been securing financial investment to support key work into this financial year, linking with system partners, which is obviously critical to this. You know, we can't do this alone. We need to do this together as a system. And then aligning this work with other important programmes, because there is alignment and we want to ensure that that alignment is good and we're not duplicating or contradicting. So I won't take too long, but just wanted to flag a few things. So the action plan, as I said, it's a 2-year action plan. What's important about the actions, that although Public Health led this plan, it's a council action plan, and it's led by heads of service and action leads across the council, and that's really important because that means that those heads of service and leads are committed to using their levers to address the educational attainment gap. You have a simplified version. There's about 66 actions in that action plan, and we're currently looking at how many of those have been completed to date and then working on the ones for this coming year. There is, in the more detailed plan, there is, of course, metrics that we're using to understand whether those actions have actually been implemented or not, and those are RAG-rated. The other area that I wanted to flag was that we've been working on securing financial investment for some key areas of work. A growth request, as you all know, was included in the 26-27 budget, which has recently been approved by Cabinet. So that's really good news. That does enable us to secure some key resources for this in this financial year, including continuation of Language for Life, including continuation of some of the learning sets with education settings, including some capacity to work on this with system partners, which I cannot underestimate the importance of that partnership work, and including to pilot some low-budget pilots, which, if successful, could potentially be scaled. The third area to highlight is our work with system partners. So there are many different, there's many different partners that are working on this. So we have the multi-academy trusts who have established a Baines Disadvantaged Network group. So we're aligning our work with that group. That's obviously key. Bath Education Partnerships, that's a partnership of head teachers across Baines. It has been secondary schools, I believe they're including primary schools now. Again, that's a really important partnership to work with. Our Mayor of Bath, so Councillor Barrett Pancania, has set up a fantastic research residency, and this time it's focused on education inequality, looking at education as empowerment. So that's been a really positive partnership, not only for this piece of work, but we envisage that continuing, which should be really good news for educational attainment, but also other wider determinants of health as well. And then the fourth area is to highlight that there's alignment between this programme of work and other key programmes. I wanted you to know that we are working with those, leading on Best Start in Life, Family Hubs, Family First. Again, that alignment's really important, but also broader areas of work. So, for example, one of the findings that came out of our research was around infrastructure and assets for youth services and children and young people. It's really important, therefore, that we link with the local plan, the work being done on social infrastructure. Likewise, our plan around cultural development. So it's really important that we are taking our cultural assets into communities and engaging with those that wouldn't normally engage with those. Likewise, we're using it to inform our conversations, for example, with WECA on the Child Poverty Action Plan. So the work that we're doing is absolutely feeding into specifics around educational attainment, but because the wider determinants are really key, we're linking with linkages. So that's what we've been doing over the...
As Mayor of Bath, my initiative for the year is Education is Empowerment. And when I made that statement at my inauguration, I didn't have a clue how I was going to address Education is Empowerment, such a broad topic. But I really would appreciate that we record this, which is the University of Bath immediately stepped up and said, let us explore this topic and let us work on the determinants, not necessarily the determinants that Amy and my colleagues here look at, which is the grades. You know, we want to look at the determinants which make the difference between I'm not going to go to school to I really look forward to going to school and I want to go to school. What are those soft determinants? And I think those soft determinants, such as taking part in music, taking part in arts and craft, painting, taking part in the Boys and Girls, the Scouting organization, all those soft skills which make that 5-year-old, 6-year-old, 10-year-old, 12-year-old say, I am looking forward to going to school. And I hope to come back to this chamber here and share with you what we found with regards to those soft determinants of, what excellence looks like. Thus far, I'm really pleased to also report that I have engaged with people like Amy McCulloch here and others, head teachers, all the head teachers in Bath and North East Somerset. And I'm so pleased that we have really dedicated and committed head teachers who really want to make it better. And they've been so receptive to somebody like myself coming over and saying, I'm not really interested in the grades that your pupils achieve, but I am interested in what does excellence look like. And I look forward to sharing with you those soft things about what makes going to school enjoyable and lifelong learning. Thank you.
Thank you. And as I suggested, you might want to update your register of interest just on that point. But thank you very much for the work you've done and also for sharing that with us now today. And I'm sure we all look forward to hearing more in due course. Are there anybody else who wanted to ask questions? Paul and then Joanna.
Thank you. As a question for Chris, you talked about the trends for the black and ethnic minority communities. And the way I heard what you said is you sort of lump them all into one group, but there's very different, as far as I can see, perceptions between Chinese, Asian, Afro-Caribbean and dual heritage. They're very mixed and diverse communities. Do you have a breakdown on those figures by that bigger breakdown? Because I would have thought some of them were quite widely diverse from the general.
Yeah, they are. The categorisation is what we take directly from the Department for Education, where we get that data from. But if you go onto the strategic evidence base, the links in the report, again, you will find a much more detailed breakdown in that, and you'll find the Asian Chinese populations in terms of BAMEs and their progress in there. But the two areas which stand out in that category, which the DFE provided us stats on, are black and other ethnic minority groups, in terms of their progress in relation to BAME's pupils.
Yes, but you're still reporting them as an overall block. You're not sort of highlighting the big differences.
For that population of children, what the information we have, there is those differences, but you will also find the education outcomes for Asian, Chinese children as well. That's in there, which are generally in line, if not better in some cases, than the BAME's averages. But it is that population, particularly of black children, and then the other ethnic minority groups, so that would be where, however, the schools have recorded that, which we are concerned about in BAME's.
Sorry, I'm not very clear. Is it possible to break that down then, so we can have that breakdown?
We can. It's all in the. It's all on the strategic evidence base, but I can get that information and pass it on afterwards.
Thank you, Chris. Eleanor, you're on my list, but I've got Joanna first, and David, and then you.
Thank you, and thank you to the Mayor of Bath for his hard work as well. My question is around 3.16, which essentially picks up on what you've just been saying, is about the research identified 10 core drivers outside of education settings that are contributing to the attainment gap, articulated as strategic goals. These are as follows: support families living in poverty to access and thrive in good work, ensure supporting social cultural capital for all, advance social mobility and aspiration, increase engagement with services, etc. Now, I think it's really interesting hearing that. There are more, because essentially what we've heard today from Becky Reynolds at 3SG is that there is less support of that kind of work. We certainly know within in schools that, you know, children being able to get music education or having time to do art is not considered or regarded in the same way that it used to be, that there is definitely a lack. And even, even in, I'm not a young person, but the sort of cultural capital of young people today is that, if you went to private school, you will be a rock musician. But if you haven't, there's no music in your life because you ain't able to do any of that. So I guess we're looking at poverty, essentially, and we don't have any money to support that in the system that we've now has been operated, and that is the fundamental problem. So it's really good that we want to work with spaces like the University of Bath, but how do we actually do something concrete that makes that change?
Yeah, it's really challenging in the current financial climate and in terms of what's likely going forward. I think there's a number of things that we therefore have to do. We have to use our resources really sensibly. We have to work with other partners to align our capacity. So when I was talking about aligning capacity, I was meaning, resources, financial resources, but people capacity as well, to ensure that we're working on the right things together. And I think that's where linking this with other key organisations and programmes is key. So, for example, WECA and the Child Poverty Action Plan. In the report, it does actually outline that an overarching core factor is poverty. Absolutely, totally agree. So that's where it's really important that we're having those discussions with WECA and other organisations. I think the intent this year is also to go and talk to the Future Ambitions Board about what they can do and how they will support this agenda. The positive side is that people aren't saying no. When we do go and talk to organisations about this, they want to support it, so I think that's incredibly helpful. But yes, it's really challenging within the current financial context, nationally as well as obviously locally.
Thank you. I don't know if Chris wanted to add anything. Are you on my list, Barrett?
Only just to echo what Amy said around that. I mean, I think the approach that BAME's has taken around what we can do and that kind of wider action plan in BAME's. When I talk about that with my Southwest colleagues, most will say actually that's the first time anyone's actually thought about taking a public health approach to this, so I think it's really innovative. But we are talking about systemic change, so this work is going to need to be done over a period of time. The capacity to which Amy referred to, which we got as part of the business case, I think is really important, because there are all sorts of levers that the council can influence, which will make things better for our action plan in terms of delivering it. We need to be pushing better for some of the road bus services. We need to be thinking about all the things which will affect and impact children and young people in their interaction with education. So having that lens which looks at that wider difference, I think is a really important step forward. But you're absolutely right, Councillor, right, finances are challenging, which is why it's more important that we work all together at this moment in time. And the schools have appreciated that. It would be fair to say that as well, Amy. Our academy trusts have actually said, that we need help in working on this as well. So it's really good to be at the table with them, rather than going, why aren't you doing good enough, to actually helping we work with you on some of those things which are happening to children outside of their education.
Thank you. David, you're next, and then Eleanor, and then Barrett.
Thank you, Chair. It's really interesting that the Baines needs assessments requests are lower again compared to national figures. And it does really seem likely that it is down to the inclusion and send advice service, given the performance of pupils with special educational needs packages. So, bravo team, well done. And it's great to see the decrease in average wait times for assessments for EHCPs, and the investment that's going in terms of staffing. I note the target of 60% of children should have their EHCP assessments done by 20 weeks by 2026. I was just curious what the national target is for this, if there is one.
There is. Laura will be here, Donnelly, at the end, a bit later on, and we'll pick up a range of issues around SEND, but I can certainly talk about that. So the national expectation is 100% if assessments are completed in time. The current national average is around 40%, and even lower than that in the southwest.
Eleanor, sorry, Paul May, then Eleanor.
Thank you, Chair. It was a very simple question, really, for Barrett. That this work obviously is going to have some outcomes. Can we make sure it's evidence-based, so that if there are implications, wider implications, that we can pick those up through Amy and Chris, so that we can actually say, this is the evidence that we've got that will make a difference. Otherwise, it's just going to be an exercise that goes round in a circle and we say thank you very much and move on. So I think it would be really worthwhile if we could, in actual fact, have an evidence base of what the outcomes could be. Thank you.
Thank you. Eleanor?
I'm really interested in the research that Dr. Pankani is doing and the way the University of Bath stepped in. That's really full marks as far as I'm concerned. We had something a bit similar going on at the University of Derby, and what we found, having got the support systems in and everything, it was the white working class male students who were really not underachieving, and they wanted a programme to support them too. So I was just wondering, it'd be it'll be good in itself for what it will achieve through the University of Bath, but it would be good if we could also look at the wider ramifications of whatever emerges and how successful it is. But we did a bit of work from the equivalent of this committee in 2014 about public awareness of what the council could offer for situations of adult social care. And what we found was that it was the ethnic minority communities which were worst informed and knew least about what help they could get of any description. And when we talked to the leaders of the mosque, who were extremely helpful, they said that partly it was the issue that there were 24 Sylheti-speaking families associated with the mosque. Now, this is a dialect or possibly a language. It's not standard Bengali that they were speaking, and they were just not communicating. So I wondered if we had any little clusters of minorities within minorities in Bath who might need some special outreach or whatever. And of course, there's always what academics say. The sample is too small. It's very good to compare with the national figures because, you know, it could very well be that it's 24 Sylheti-speaking families who are skewing our results.
I think that's a very valid point. I don't know whether Amy or Chris wants to pick that up.
I think it's a really important point. Within the action plans, when we're kind of looking at delivery, within the action plan, there isn't one specific action around ethnic minority groups, but what we've done is we've taken that kind of equality impact lens across all of the actions within the action plan, so that as appropriate, actions are doing that work with local organisations to ensure that we're reaching into and with communities as appropriate. And quite a lot of the actions are absolutely about that very proactive outreach with our communities and families. So it's kind of there across actions. In terms of inclusion within research, we did deliberately, target our sample to include some minority groups. But yeah, the key next step is absolutely about ensuring that our delivery is working with communities and third sector organisations and others as appropriate to ensure that we're getting it right.
Thank you. Right, so I now have Barrett and then I'm going to ask a quick question. So,
I feel Councillor Wright has hit the nail on the head, absolutely. And she's addressing the elephant in the room, which is poverty. It is poverty, and we know it is poverty. And what I'm working on is addressing that elephant in the room, which we all know. I can't make you better off, because I haven't got the money to elevate you from your poverty. However, what I can do is improve your educational experience. Because as Councillor Wright correctly said, you will become a rock star when you go to the private sector schools. Of course you have the ability and the opportunities and everything to play those musical instruments, to take part in the cricket and the hockey and the everything else, the public speaking. And that is where my focus is coming in from, which is, can I show the evidence through those soft skills, which we can then, as a public health measure, target, especially target the schools where poverty is at play, and say, this is what we bring to you as an optional extra, not as an ancillary. You see, joining the cricket team, the music club, the arts and craft thing is a given in the affluent schools, whereas the schools that are financially poor, not the schools themselves, but the population, that is where the public health intervention may bring benefits. And then in answer to my friend, Paul May's call, which is, I hope this will be evidence-based, I wish to answer in two ways, which is, yes, we are looking for evidence. Unfortunately, that evidence is not as robust as you would like it to be in a double-blind controlled trial like we do with drugs. It is a soft skill. A lot of evidence exists already, and I will engage with my University of Bath colleagues to show you that evidence if you need it. What I am doing is looking for that similar evidence in Bath and North East Somerset schools as well, to say, look, this is the picture locally. We already know what the picture is nationally, with lots of national and international evidence. Thank you.
thank you. And I think we would all agree that poverty is key in actually getting that better, or addressing poverty is key in getting a better education experience. So I had my question, which is actually quite related to what you were what you have, work that you've instigated, which is around the value of the work St John's had done and whether or not that has been reflected in the current figures that we have before us, or if we will expect to see in a future report a sort of an up and then some change now that they have pulled out of that work in our, well, particularly they were starting in some of our more disadvantaged schools that served our more disadvantaged areas. So sorry, that's a question for Paul, but it might be something you too might want to reflect on in the work that you're doing.
Ask Chris to answer that.
Thank you. I think it'd be difficult to quantify the impact of that work in the actual statistics, but in relation to the schools specifically that St John's were in, they have got published reports around that, and you can see some impact on, particularly I think in phonics and in reading. However, the overall impact in those 7 schools isn't exactly where I think we would have wanted it to be, or where St John's would be in terms of that. But coming back to the point around the softer outcomes, there's all sorts of other information that St John's and the research has gathered about impact on wellbeing, about impact between parents and relationships with schools. And I believe those reports are all available online on the St John's website. You can reach out and read that. The final one, which they is due to be published soon in terms of those actual outcomes.
Thank you. And obviously any help you want to give me, Chris, in finding that would be welcome.
I can do that, no
Thank
problem.
you.
I think I'm just giving my answer as well, because I think we were disappointed when St John's walked away from, or is walking away from this support, because it was a positive indication to the schools that we were supporting them in difficult circumstances, because it's very easy for us to sit there blaming the schools, but the schools have to deal with those circumstances. So it is an issue that we need to be thinking about more in the future. And if I could also go back to Barrett's point, in a previous life I was with a body called the Learning and Skills Council, and one of the key issues that I learned from there was across the country, in different communities, deal with poverty in a different way. If you go into Birmingham, you can find that poverty is actually a driver for change. In areas like Bristol, Knowle, you find that poverty is an excuse for no change. So it is an issue, I think, that we can make a real difference if we actually can work with communities and generate those communities wanting to see their children actually improve. I mean, I've seen situations in Bristol where a child is doing really well at school and the parents will take that child away from school because they don't want. So it is really important, I think, that the work that you're doing, and we very much welcome that, Barrett, and I hope we'll take it on board. So thank you very much.
Thank you. Right, I'm going to move on to the next item, unless you had anything else very small, Barrett.
Look, I think collecting evidence is really important. It's difficult, but we are collecting it and I'm mindful of it. I just wanted to add one more thing, but it will take a long time for this study that we're also doing to report back, which is this. Voices for Life is an initiative to engage young children to take part in singing and then performing in public. What I have started is asked the Voices for Life organization to do a longitudinal study to match the children who took part in the singing compared to the children who didn't take part in the singing, and then follow them up over several years and then see what the outcomes were, and compare the engaged group versus the non-engaged group and see what happens. But it will take a few years to report back.
Thank you. And I think that is something that we all should bear in mind, that very few things are instantaneous. Yes. Right, we now move on to the Children's Services Placement Sufficiency. I am aware that we are running quite short on time, but I am still hoping to finish just after 1 o'clock. So please bear that in mind. Paul May, as you talk about this item.
Thank you, Chair. I think if I can just stand back for a second, the agenda we've got today is really, really full, it's the great shame is that, if you like, we don't give this enough attention, because this is a really, really important report that's been produced, and it's complex. It's not just, well, it's about fostering, it's about sufficiency of places. You know, it's a really good report. And the background to the fostering part of this report is the government have stated quite positively that they want 10,000 more foster carers in the country, and that we should in actual fact then set up a regional hub which has been up and running for about 2 years now, but it hasn't been about actually providing foster care. It's been a front door system. So the system is changing, and it's hopefully going to be changing for the better, because the report quite clearly identifies that foster care is the best solution that we can do if we can do it. And I'm sure Jean and Phoebe will actually highlight the fact that those front door issues have been referred through to the local authority, and how we then convert those into real foster carers is a major challenge for us moving forward. And there is reference there to children's homes and the numbers of children that could possibly benefit from that, which we saw as a council policy quite recently, that we actually should be trying to deal with children in the same way as we're dealing with education through local provision. We should also be looking to see whether there's social care we can do through local provision. So I'm sorry if I've taken over too much, but I think this is a major report, and I think it's really important. So I'll shut up.
Thank you. Phoebe, did you want to add anything else?
Yes, so I'm Phoebe Holland, I'm the Interim Assistant Director for Children's Services. Given the time limits, I will just give some headlines of the report and then take questions if that's sufficient. So the report details the profile of our children in care. At the time of writing, 228 children in our care. 38% of those are in-house foster carers, 21% are with kinship foster carers, and 21% are in residential care. 12% are in 16-plus provisions, which is a range of different types of provisions. So just to focus on those who are in in-house foster care and residential care, and thinking about proximity to Baines, where their home addresses, their original parents' home addresses are. So for those in in-house foster care, 74% are within 20 miles. So there's a real positive for enabling children to be in foster care placements. Comparatively, for those in residential care, only 45% are placed within 20 miles of their parents' home address. So you can see that the difference in those children's experiences, both in terms of how they can spend time with their families, but also in terms of how they can access support from professionals who know them, including whether they can remain within their education provisions in Baines. So there's a clear case for change. We know we have 3 children in residential care who we have live placement searches for foster care. We cannot find suitable foster placements for them. There are other children who are in residential care where we have ambitious plans that we want to support them to get to the point where they are able to step across to foster care. So in that context, that has led to us investing in and developing a sufficiency programme, and we now have a sufficiency lead in place to head up that programme to ensure that the right capacity and resource is focused on progressing our arrangements for children in our care across a number of work streams. So there are 4 work streams. Those include a work stream looking at foster care arrangements, both in terms of our recruitment of foster carers and also our retention of foster carers, including a strategic needs assessment, an end-to-end review,
and consideration of strategies that will enhance our recruitment. We know that we need to be doing more to bring new carers in. We are looking at residential children's homes, thinking about an assessment of developing and operating an in-house children's home and whether that is a viable and suitable option for our children. The third aspect is looking at resources for disabled children, and particularly focusing on short break and direct payments arrangements for our children with disabilities. And then the fourth element is looking at 16+ support and care leavers accommodation, and that includes recruitment of supported lodgings carers. As has been mentioned, we've been looking at the government reforms, and the report highlights some work around the end-to-end fostering hubs and regional care cooperatives, and we are actively participating in regional groups to progress that work. And I did just want to highlight that alongside all of the work around our children in care, there is a significant amount of work looking at both enabling children to stay within their families, where we are identifying that they are at high risk of entering care, so that we would reduce the numbers of children in our care. And that really centres around our practice frameworks, systemic approaches to and interventions to working with children, and a specific systemic approach called Families Together, where we're using intensive systemic interventions to support a small cohort of children where we identify there is a high risk of family breakdown or risk of entry to care. Alongside that is our fostering families approach, where we have recruited a number of fostering families carers. They are not formal foster carers, but we use a similar approach to assessment and approving them at a panel. And they are carers who are there to support children in their own family homes with 15 to 30 hours of support a week, which is really flexible depending on the family's needs, to mirror a typical kinship arrangement for those families where they have very limited support networks. And finally, I just wanted to highlight that we've got a really clear and ambitious approach to reunification work in Baines. It's centred around the NSPCC reunification framework, and we have an in-house systemic family therapist who supports the reunification work, and we have had a number of children successfully returning home off the back of that. So I will take questions. Thank you.
Thank you very much, Phoebe, and thank you to Paul. And now I'll turn to the other Paul, who has questions, and then I'll come back to you, Paul. No, it's you, Paul.
Right, sorry, too many Pauls here, aren't there? Thank you. First of all, congratulations on the awards, and I hope you achieve at least one of them when they come to it. My question is, could you sort of give us a bit more detail? The thing that really concerns me is when a child has experienced a household with severe domestic violence, which is usually male on female, but is occasionally female on male. So how do you work with children when you've got a family that is out of trouble, that is experiencing high levels of, and repeated levels of domestic violence?
I presume we're talking about where the level of risk is so high that there are particular concerns that that could be a child that would be at risk of entering care. When we're talking about reunification work.
Can I remind you all to use your microphones?
When you return a child to a place where domestic violence has been recorded.
Thank you. So the purpose of the reunification framework is that there's a really robust assessment tool that looks at the original concerns that led to the child entering care, the distance travelled since then, and what the strengths and protective factors are that would enable a child to return home safely. That would apply to all different contexts, but for the context of domestic abuse, we would be looking at what changes have occurred either within the relationship, if it's continued, or that have enabled the main carer to end the relationship safely and maintain that separation if that was what was necessary for a child to return home. We have a variety of arrangements and support for families where there's been domestic abuse, and our social work teams will be working in partnership with those professionals. So within Children's Services, we have a team called the Family Support Plus team, and in that team there is a specific service called New Way, which is for working with families where there's been domestic abuse. So some of our children who are returning home from care have had long-term support from the New Way service to enable that to happen. In other family contexts, the main carers may have worked with our systemic family therapist over a period of time prior to reunification taking place to think about what the relationship dynamics are, how that's progressed, involving children in those conversations so that there are really open conversations within the family about what's changed, and helping the child to kind of understand that distance travelled.
If you return a child, is there a sort of a policy like it's 2 strikes and out? So if you return a child and there's another instance, then that's it, the child is taken away full time?
It's very difficult. We wouldn't have a blanket policy because it has to be, we have to assess the level of risk and need at any given time. What I would say is that the reunification framework has a really strong ongoing support arrangement for those children. So we have a commitment to supporting them for at least a year once they have reunified home. They will typically return home under a full care order, so that the local authority maintains that really strong corporate parenting approach for those children, and we will assess through our legal panel at which stage it's appropriate for the care order to be discharged, and for the ongoing support to continue under the Child and New Plan.
Paul, other Paul.
It was just a fairly quick point. We've all seen and heard about large local authority children's homes. And although we've made reference to that, the work with Jean and Phoebe is very much around what are the specific needs of young people and dealing with those perhaps locally rather than actually going out into one large home. So it would be possibly a different model, and increasingly up and down the country, children's homes are now being created and being dealt with by local authorities, where in the past they all walked away. And that's why we picked up such a difficult financial model with providers, because the balance hasn't been there in the marketplace. So it's something that we won't just jump into. We've got to deal with it really, really sensitively and based around the needs of those young people.
Thank you. Who else was on my list? Joanna?
Thank you for your report. I notice it's just for noting, and and I understand why it's for noting, and the amount of work that you've done, and the thought process that has gone into this. But again, all elected councillors are corporate parents, and I just wonder again about sort of thinking about leadership and how we take this forward. Is that we have a real problem with the request to get fostering parents, and how do we take that back to the corporate parents and make them the leadership to do that? Because we need to give out a better message on this. And I just think that it might be useful sometimes for reports not just to be for noting, but to have an action in them. And that's a request from you for us to do something for you. And I think this is one of the cases where that should be the case. Because clearly there is a problem. I certainly know that when we put the Tree for Life in, the fostering team came there, that was really appreciated. And the reason for that tree was as much to ensure that we have a space, that we have a place for everybody that understands our care and our responsibility as citizens to this group of people, and how do we work better. So I guess I'm not just looking at you, I'm looking at the Cabinet member, how he goes back to Cabinet and discusses that, and how we come back even to Cabinet and full Council with that request to do more, because I do think that it's a wider issue. There are clear issues on a separate issue on the kinship and how we place young people back. I must say I can see that there's a financial drive to do this because it costs so much. Well, that's what I'm hoping it's not a financial drive. And I think for lots of people, that's how they read it. So I guess there needs to be a real understanding of where that line comes from and why that is, because certainly in the experiences that I've had with other people on this issue it's a very complicated one, and how to do it well requires an awful lot of attention and detail. And we've heard from a whole group of people today about how unhappy they are about the attention and detail you're just about to take away from them. So I think that this report almost needs to come back in 2 months' time. I think there are quite a few people who aren't in the room who would have a lot of questions on this, and it's a big topic. So I think there's more to be done, and it's how do we do it again.
And that's what we can do. So I think we can definitely note it, and we can have it come back for further information. But I think it's also worth noting, and I don't know if Jean was going to say this, but it's not just a local issue about recruitment of foster parents. It is a national problem. Jean.
Just a couple of things. This report is going to go to the corporate parenting group because it will be part of a much fuller conversation. So there's an opportunity sooner than the next time this group meets, and that may address those issues. If not sufficiently, then we can come back here. And I think the issue about kinship care and the drivers there, the evidence, national evidence over decades, is that children in our care mostly gravitate back home at some stage. Excuse me. And kinship care isn't just about birth family. Of course, it is about that wider network. And often, the wider network aren't always ready at the point at which we absolutely need them, although many are. They actually will often think about it later on for children. So it's about keeping it open as an opportunity, and it's largely based on the evidence about what children choose to do as they grow and develop, and how do we support that in a much more proactive way. And I think there's been some really positive work in this local authority to really enhance that approach to privileging immediate but also extended family networks.
Yes, if you could make whatever it is you're trying to do work.
Sorry, yes. Just firstly to recognise and appreciate that leadership approach to corporate parenting, and we really welcome that. I think this is in its early stages, this work, and what we don't want to do is jump to conclusions around this is the answer and let's do this without really thinking that through, doing that strategic needs assessment and coming back with a really well thought out proposal of what needs to happen. So I would welcome the opportunity to bring those proposals back for approval at the relevant times. And just to echo, I think we are really clear that children who are supported in foster families or kinship arrangements, in most situations, their outcomes are better. And that is our primary driving factor behind all of the work across all of those different work streams.
Thank you. Are you going to say something, Paul? Tiny?
Ever so small. On the kinship care, we've sold this concept to the South West through the lead members group because we've been there working with an evidence base in favour of it, because we've taken a lead on kinship care, and it's really good that the government is now picking up that theme and driving it forward through Families First. So I think it's not about money, just to be very clear. It's about that young person actually having some links back and forward when they become into care. And I think it's really, really important, and we should in actual fact celebrate it because when it works, it can work really well. It takes quite a lot of effort to do it effectively for that young person, because they may not want it initially, but as they get older, then they do then want it. And then how they engage then with old friends, with the family. And I think it's really, really important issue that we should feel proud about in this authority.
Thank you. Right, we now move on to the, not sure if it's the penultimate item, I think it almost is, and it's the SEND EHCP update. Thank you very much, Laura, for coming to this meeting. If you don't mind, I think what we might do is we might move straight into questions, because the item is for noting, but also with questions for you too, and I think that might be helpful. Obviously, if there's more that you wish to add into your answers to those questions, I'm sure that will be appreciated. Paul, did you want to briefly introduce this? Because I suppose I was supposed to ask you that.
Very quickly, because I'm out of my depth. In particular, I just wanted to make sure we're welcoming Rachel Hell from the Parent Carer Forum, because that's really important.
I was going to say welcome
so
to Rachel as well. Yes, and welcome Rachel too. Okay, so do we have any questions for or about SEND or EHCP, bearing in mind the questions and responses that we have already covered earlier in the meeting? Joanna.
Thank you. I have three. Refusal to assess is the most common reason for appeals. What is BAMES doing to ensure children and young people are assessed appropriately when they first apply, instead of waiting for parents to appeal the decision to not assess? A refusal is to assess, and an appeal which is then overturned leads to a significant delay in assessment for a child or young person.
Thank you, Councillor Wright. Thank you, Chair. If I just refer you back to the paper, we have been working on that quite extensively, and you'll see there's a graph there that shows that the number of refusal to assess appeals have dropped down to 0 over the last few weeks. And it's a really difficult thing to get right, actually, the assessment process, because we know that the majority of times when a refusal to assess goes to appeal, the local authority won't be able to defend that refusal. For example, we were at appeal a few weeks ago when the school stood up to the tribunal and said this young person does not require assessment. We have done our own assessments. We've had an educational psychologist, we've had a speech and language therapist. We absolutely know what they need, and it can be met by the school. Still, the tribunal said that we should go ahead and assess. So it's a really difficult landscape around that, and balancing how do you balance your resources versus making sure that you're not disadvantaging young people who do need an assessment. And that's why we've worked hard to make sure that our panels are as fair and equitable as possible. They're always multi-agency. They include our colleagues from social care, from the health therapies providers, and our school colleagues as well, to ensure that we are just monitoring on that legal test. But ultimately, if we say no to an assessment, even if we believe that that is a legal response, we will probably lose it at appeal anyway. So we will then at that point try really hard to mediate with that family to move forward. There's a moving picture around families wanting to engage with mediation, and it's a real shame. They're feeling like they don't want to mediate with the local authority, they want to go straight to appeal. There's rhetoric coming from some of our peers in Special Needs Jungle and other organisations around wanting to go straight for appeal, when actually if we can go to mediation first and talk with the family, we can usually resolve these things really quickly and stop those delays. So our message will always be to families to talk to us as much as possible. Still log the appeal if that's what you want to do, but talk to us so that we can make sure we really understand what's happening for the young person.
Reasons for complaints. Provision not being delivered has increased significantly, with 11 complaints in the first half of 25-26. What is the reason for this, and what is BAMES doing to resolve this?
So I think the reason for this is often EBSA, so school avoidance. From young people, mental health reasons often. So if you've got a plan that's in place where you have sent all of the money to the school to deliver that plan, and that seemed appropriate at the time, but the young person can no longer attend for a reason for a number of weeks. If the school was providing that mentoring, for example, that's written into the plan, then they have to really quickly turn around being able to deliver that in the home or another location. And because of the increasing number of young people struggling to access a school setting, it does take a bit of time, and I wish it didn't, but to move over from can we reintegrate back into school, not too quickly moving to in the home, when we can reintegrate back, and when we can't, how do we get the right people to go out and do that work? The majority of the time it's around non-attendance at school that's the underlying issue around that. So we're working really hard with our schools around supporting young people to attend, as you know, and I'm sure it's been spoken about today, but our education psychology service in particular, offering a lot of support to our schools, and our inclusion and SEND service doing the same, to ensure schools are best equipped to reintegrate those children back quickly if they can, and if not, they know what to do to move that forward. But rightly so, parents will come to us to want to discuss that, because it's our legal responsibility to provide that for the child or young person. But it is tricky when you're in an academised system and you are paying that academy to provide that provision, and that's why.
Annual reviews of ECHPs are vital in ensuring a child or a young person's ECHP is up to date and meeting the needs of the child or young person. What is the average delay in issuing paperwork for annual reviews?
So it's one of the things we've found really tricky to measure at the moment, and we have looked at how we report our data to try to improve that. And so a recent dashboard starts to be able to pull that data forwards, but we haven't had that in the past. What I can tell you is that every child always has a phase transfer review, and that's always done on time. So that's when you're moving between schools or between key stages. So that's every 3 years for children and young people, and at that time we really thoroughly review the plan. Now, the law's really clear and the Code of Practice is really clear that there's no need to do amendments on a plan every single year. You must have a review, and they are held by our schools every year. And what we're not good at is sending a letter out after those reviews to say that they've been completed, and we do need to improve that, and that's one of our targets for this year. But every 3 years, that plan is really thoroughly reviewed, goes through quality assurance to make sure that it's up to date, and the interim things are managed by the schools. I want to improve our statutory compliance around that, and I want to improve our data, and we plan to do that over the next year.
Finally, I can't read my own handwriting. I was a bit disappointed to see this in Appendix 3 on page 8. Send ECHP update. We recognise that work needs to be done to improve our adherence to statutory timescales, and the service is working hard to ensure all families work well during this period of stretched resources. But clearly you've got a problem that you aren't working to your statutory timescales. So I guess my, I'm disappointed that that's sort of so far hidden in the document, and I think that should be a bit more robustly put forward, because we are just noting this anyway. So I just think we need to be a bit more honest about this, because I certainly know from speaking to families that's their issue, and by being honest about it, then hopefully we then support them in a better way.
And while I appreciate your views on that, Councillor Wright, I don't agree that we've been dishonest about that. We've currently got around 35 plans that are over 20 weeks at the moment, out of 250, and I'd ideally like that to be 0, but I think that is probably nationally, those numbers would look really good against other local authorities. Now, it's an interesting system where the plans only count against you once you finalise them. So you can sit on a huge backlog and look like you're doing really well. We don't do that in Baines. We finalise our plans as quickly as we possibly can, and like I said, there's about 35 families that have gone over 20 weeks at the moment. I would rather have everyone done in 21 weeks than some done in 19 and some done in 52. And we've worked really, really hard to bring down that average number of weeks for families so that everybody is waiting the least amount of time possible. Our education psychology team has worked really hard to get the assessments in more quickly, and there's been a huge investment in that. I think when you talk to our families and our parents and carers, and I did last week at a parent-carer meeting, I'm hearing that the picture is much improved from where it was before. I'm hearing communication is much better than it's ever been before as well, and that they are happy because they know why. If it's late, they know why, and they know it's a good reason why. I would ask us all to focus on the quality of plans as well. It's much better to have a high-quality plan in 21 weeks than it is a really poor quality plan in 19. So we need to balance all of those things. I can make those figures look better by forcing them through, and then maybe even doing an amendment just a few weeks afterwards to improve the quality of it. I don't want to do that. It is a genuine and honest response to you in terms of how many weeks it takes at the moment, how we're working to make sure that's equitable, so it's not just for some families, it's for all, and how we make sure the quality is really good. But thank you for your challenge.
I guess what I'm really sort of trying to pull out is, I accept your clarity on that, is that you still have a young person's life, and that time taken out of their lives is enormous. And what seems to be most problematic is how the family around it have to cope with that issue and the long-term impact that has to them. So by having that clarity of what you've said would help a lot of them understand why they're in that position. And I just wonder if there could be better communication about that.
I think Laura's nodding. Rachel.
Can I just add something as well? So as the Parent Carer Forum, part of our role is to be the strategic voice for families within the local authority, and we have around 1,700 members at the moment. We're trying to do a lot of work around communication with the local authority because we acknowledge that it's a difficulty. Communication across the system, not necessarily just with the SEND team. And any of the councillors are very welcome to contact me and talk to me about the data we hold. The SEND reforms are really interesting with what's going on there because one of the things they do talk about is things being fair, and it's really important to ensure that when we're hearing families' voices, we're hearing all families' voices. And what we often hear is people would rather it goes slightly over time, but it is a good quality, robust plan than something's finalised in 20 weeks. And I think that's just really important to let people know because there's a narrative that gets hidden in data sometimes.
Thank you. Right, do we have any more questions on the HCP? Okay, well, Paul, do you have questions?
No, it's not a question. It's just to round it off, Chair. We are several years after our last joint inspection by Ofsted and CQC. And I've said publicly that if and when this comes in, which we've been expecting it for a long time since Christmas, that if there are any issues there, we will deal with those issues effectively and properly. So just to give that assurance to the committee.
Thank you. And I suppose my only add-on from that is that I think it's useful for us to kind of get regular updates. So we'll sort of timetable that into our agenda setting. So thank you, Laura, and thank you, Rachel. Okay, so the next item, I'm going back. We can have the work plan first, as it's literally next on my agenda, and then we'll go to the minutes. Is there anything else that's missing from the work plan that you would expect to see, bearing in mind the various other items that we've mentioned during this meeting? If not, as usual, if you could contact myself, Mark and Kerry, and we can make sure that those items are added onto the plan. Almost finally, the minutes from the 17th of November? Is that really the right date? Yes, the last minutes anyway. On my notes, it's just got the wrong date. That's okay, Mark. So do we agree that these are an accurate record of that meeting, and are we happy to accept those minutes? He is unwell. He might be watching though. And then finally, our next meeting. Actually, I don't know when our next meeting is. Mark, when's our next meeting? Next month. April the 14th, I think. Which will be an adult focus meeting, and obviously you'll get the papers and invitation to attend in due course.
20th of April, I think.
20th of April. Okay, so it's slightly longer than a month away. So may I say thank you very much to everybody for attending. I know it's been a very, very long meeting, but all of your contributions have been very much well received and welcomed, and I look forward to seeing you all at our next meeting. So that's... We always look forward to your visits, Eleanor.